Hello, my friends. Hello, hello, hello. We're starting the stream up. Thank you to whoever's on YouTube who is waiting. Thank you. All righty then. Let me make sure we've got everything going here. All right. We are live. Hello, everyone. My name is Jill Osborne, founder of the Interstitial Cystitis Network. I never thought when I was younger that I would be a face and spokesperson for issues with the pelvis and the bladder, but here it is. So my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the world at this point in time. Hello, Pam. Hi, Julie. It's nice to see you. This is our National IC Support Group meeting. We do this almost every Sunday. It is watched live on Facebook and YouTube, and then within the next 24 to 48 hours, several thousand patients will often watch it at the same time. Some of you listen to it, and I'm so thankful for your support, and I'm so thankful that you believe in what we're doing and what I'm doing, and I am. I hope that when you come to these meetings that you have an opportunity to learn new things. This is all about opening doors, my friends. We want to open doors. If you're not responding to therapy, if you're getting better rather than worse, if you have been in bed for a couple of years and you don't know why, and the doctors are not treating you, my job is to give you context, give you options, and hopefully kick you in the you know what, get you back out so that you can have good, honest discussions with your doctors about where you are and where you would like to be. I bring to you 3 college degrees. I have a degree in chemistry, yes, geek. I have a degree in pharmacology, drug development, yep, geek. It's a pretty rare degree, actually. I had a surgical internship in that degree for a year. I did give up that career because I love animals and I couldn't tolerate the animal research. So I went back to grad school and went into psychology. So I have a master's degree in psychology. I have a presidential fellowship, and the IC Network, our website, icnetwork.org. Whoops, there you go. You can see it all right there. Was my doctoral dissertation proposal. How can we bring support to people who are homebound? And ironically, I was so homebound, I couldn't finish the doctorate. But I am so happy that our website, my little proposal 27 years ago, has been rated #1 in the world by Harvard Medical School, and the University of London is the most accurate, reliable, and credible. And I think that one of the reasons why we have been as successful as we are is that I curate content really carefully. And, if you've ever signed up for our free newsletter, I don't send a lot of newsletters out. I don't, because I want to respect your time. I want to respect your inbox, and I want to be relevant here. And I have never sold our mailing list. We never will do that. I don't contact people unless they contact us first. I just want to be a warm, soft, happy place for you to land if you're struggling with bladder and or pelvic pain, right? That's my job. And guys, I kind of want to say this. We are a community. We do this together. I'm just like you, man. I'm a patient. I had a lot of conditions in my 20s, a lot of the related conditions because I'm IC subtype 5. But I couldn't have done this without the support of many of you. And ultimately, in the end, even though we're alone at home, and as hard as that can be, you always have to remember that there are millions of brothers and sisters who are struggling with this, who have your back. They are standing with you every time. I want you to pretend that I'm walking right there with you. I want you to walk into your doctor's office with confidence, with knowledge, with I don't want you to walk into the doctor's office and burst into tears. That's not helpful. We need to walk into the doctor's office prepared, ready to talk turkey, ready to talk options, ready to take the next step. And that ultimately is my goal with these meetings. But I want to tell you a story. Donna, thank you. Donna says you're one of the best, Jill, for credibility, hands down. Thank you, Donna. I appreciate that. Hi, Becky. Hello, Penny. Hello, Alicia. So we're simulcasting again right now, Facebook, YouTube. If I'm looking up here, I'm looking at Facebook. If I'm looking down here, I'm looking at YouTube. Hello, Ruth from Philly. Hello, Alicia. Hello, Monica. Hi, Deborah. Hi, Sue. Hi, Julie. Hi, Crescenda. Carolyn. Carolyn says, hope you're well. You know what? I'm having a fat day. I, I ate something yesterday and I just woke up going, I think it was, what did I have? Oh, you know what it was? Is I made 2 nights ago, I made pasta for my parents. I normally don't eat anything with gluten. I just don't. I feel better when I don't do gluten, but I do. Hello, Dee. Dee says, I'm new here, just hoping everyone is well. The site gives me so much support. Oh, hon, I'm so glad we can help you. Hi, Carolyn. Hi, Shannon. Now, you guys, if you find these meetings helpful, please come on over to our website, icnetwork.org, and sign up for our free newsletter at a minimum. Hello, Helen. It usually takes me a week to write a newsletter. Just telling you, I put a lot of work into it. Hello, Alicia from Charlotte, North Carolina. Hello, Nancy from Missouri. Hello, Shannon. I'm pain-free thanks to you and all your wonderful support. Yeah. Oh, yes, 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 yes. Girl, I'm so glad you're better. See, remember, I've told the story. I had a doctor tell me that I would forever live with severe pain. He said, "You will be a burden on your family. You will forever live with severe pain. Get used to it. This is your life." And that is when I took stock, took a step back, and I started fighting. And he was wrong. I haven't had intense pain. I see pain for 15 years now. He was wrong. So anybody who's telling you you're going to be in pain for the rest of your life, screw them. Let's dive into the basics. Okay, so hi Meg. Hi, Sherry. Hi, Carla. Carla says, I have no idea what I would do without you. I spoke to a patient of mine Friday who has IC and endo like me. I told her all about you and your amazing page. Awesome. So, Sherry says, Jill, if we have pelvic floor dysfunction, why does certain foods make us hurt? Okay, remember in the pelvis, you guys, and actually, I'm going to come back to that. I want to tell you a story first. Normally, when I do these meetings, the first 30 minutes is educational. Then we dive into questions. Then we go into Zoom for a Zoom chat, and then we come back. So, Sherry, I'm going to come back to that. I want to talk about a patient that I worked with this week or last week. Her husband called me and was looking for information. And I won't say what state they were in, but let's just say it was a state that didn't have a really good community of pelvic pain providers. And she had literally been bedbound for four years. And it started like 6 years ago. Told it was IC. She did every IC therapy you could do. She never got better. And she was desperate, absolutely desperate. And if you're watching, because I told her to come into our support group meetings, I'm sure I'm going to get something wrong about your history, so bear with me, but I'm going to try to get it right. So anyway, I'm going to try to get as much right as I can. So here she is, basically bedbound 95% of the time. And we're kind of just going through, because remember, you are all an anatomical mystery to be solved, right? We have to understand your pelvis. We got to study your pelvis to try to figure out what the hell is triggering your pain and discomfort and or your bladder symptoms. And so we have this very long kind of discussion, and I'm just in my head, I'm always like trying to understand, okay, what's going on? And I say, well, can you sit? Can you sit down? She's like, not at all. And I'm like, oh, isn't that interesting? Okay, so when you sit down, does it hurt? When you stand up, does it get better? Yes. So if you've been in this meeting, if you've been a member of the IC network, y'all know what that is, right? That's pudendal neuralgia. If you have pain when you sit down that is relieved by standing up, if you have pain that is triggered by movement, especially bending over, squatting over, we're going to really be looking at something called pudendal neuralgia. And so again, talking to some of you guys is hard because I really got to just like, I have to ask a lot of questions. Is the pain inside? Is it outside? Et cetera, et cetera, et cetera. Her pain was inside. So I said, well, do y'all have any other weird symptoms? And she goes, God, never tell anybody about this because I'm so embarrassed, but I have this painful arousal sensation. She's had it for a long time. All right, guys, y'all know what that is. Persistent genital arousal disorder. Y'all know why that happens? Because the pudendal nerve is being compressed or traumatized by tight muscles. So now we kind of stepped away from Hunter's lesions, didn't have Hunter's lesions. We stepped away from bladder wall driven, and we're really now looking in her case at muscles and nerves. Because she's got the two key signs of muscle and nerve dysfunction. She's got pain when she sits down, and she's got persistent genital arousal disorder. So now it's like, okay, take me back in time here. Take me back in time. Did you suffer any traumatic injuries when you were younger? And she said, yeah. She had 3 babies, and in one of the babies, the baby was face up, and they had to cut her massively. So she ended up with severe scar tissue, but I think that they actually cut into her bowel so that there were issues with that, right? So we know she suffered significant pelvic floor trauma when she had 3 babies. But it turns out she was also in a very abusive she had been in a very abusive relationship, and she was abused. Okay, that makes more sense. And then we just kind of were walking back in time a little bit, and it turned out she was also sexually molested when she was younger for many years. And this is one of those kind of heartbreaking stories where you want to say, and I do say, "Oh my God," right now. I close your eyes and you just feel the biggest giant hug right now. I am so, so sorry that this happened to you. But then the next message that you get to say to somebody is, do you know what? This isn't your fault. You've done nothing wrong. No shame, no blame. She was injured badly for many years. And, it's funny, when I woke up this morning, it was feeling like a little bit of a melancholy day. And I think that maybe this is why, because I've really been thinking about her a lot. One of the things that we women do, that we just got to call it like we see it, is we think that we are damaged goods. We think that we are unlovable. We think that we are unworthy. We think that our husband should go have an affair. We think that our husband should leave us because we have pelvic pain or we can't have sex. And I'm telling you right now, stop it. Stop it. You have done nothing wrong. You are hurt. You are injured. Having pelvic pain says nothing about you as a person. If anything, what it says about you is you are a freaking strong woman and you are a survivor. And for the men out there watching this too, the same thing for you, because some of you have gone through this too. I don't want you any blame about this. Now, why do I? Because I went through that in my 20s and in my 30s. I felt like I was being punished. I didn't understand what the heck was going on with me. I didn't understand why my life wasn't normal like the other people's were normal. I didn't understand why I was laying in the fetal position in my living room in pain. I didn't understand why having bowel movements hurt. And the shame was palpable. I get misty thinking about it. And what changed it for me was when I got new glasses here and they're not quite set up right. Let me put my other glasses on. The thing that changed it for me was when some of the first research came out that showed that this could run in families. It's like, oh, wait a second. Well, my mom has this, my sister has this, my grandmother has this. Wait, it's genetic for some of us. There can be hereditary. Oh, I see subtype 5, chronic overlapping pain condition. Central sensitization can be passed along in families. Okay. I inherited part of this. It was never my fault. Never my fault. And it is not your fault either. And I am so, oh God, I could cry over this. This is how I woke up. I woke up steamy about this. When I think of that woman who was brutally, brutally abused as a child, and then she got into a relationship where she was abused too. And I truly believe that the reason why she was bedbound to a certain degree, not only was because of the pain, was because she felt shame. And the fact that she wouldn't say that she had this painful arousal sensation, which is a classic symptom, tells me she was living in shame. And please, please, please don't do that. Please don't do that. This says nothing about you as a woman and a man. You are hurt. You are injured. You are injured. And here's the thing you can count on. Number one, you can count on me because I'm here for you. You are my purpose in life. When I think about why my life is the way it is because I think I was born to do this. You can count on me. I want to be here for you. But here's a more important thing. You can count on your body. Your body is wired to heal. Healing is always happening. It never stops. But the challenge is sometimes we get in the way of healing, and sometimes we don't understand what's injured. And that's what we have to talk about is making sure that we're creating an environment that will support healing. And more importantly, we got to figure out what the hell is wrong in the first place. So here she is. She's in bed. She's told she's got IC. She's given all the freaking bladder medicines. Nothing works. Doctor after doctor, you have IC, you have IC, you have IC. And what do I say to you? Please, please don't go to a new doctor and say you have IC. You got to walk into a new doctor's office, and you've got to say, I am here to try to understand what is triggering this symptom. Can you please help me understand what this symptom is? And if she had walked in and said, whenever I sit down, it hurts really badly, but when I stand up, it gets a little bit better. And I hate to talk about this, but I have this really weird, painful sensation around my clitoris. And any good doctor would have said, well, that's certainly not your bladder. It sounds like your muscles and it sounds like your nerves. And so what was so great, and like the best part of my job is to open up that new door and that new window. It's like, okay, let's try to figure this out because you're not having your symptoms at all. You have pudendal neuralgia, 100%, no doubt about it. And it's like, did you ever have sciatica? Yeah, all the time. Tight muscle squeezing nerves. And so really in her case, it goes all the way back to the fact that she was tragically abused. And we've had research that's talked about that to a certain degree. And I certainly was never abused sexually. I can't blame my IC on that. And the one thing we say for sure is we don't make all statements. We don't say everybody has this or everybody has that. But for some people, there are early traumas, early muscle traumas that can trigger lifelong tight muscles that have never been addressed correctly. So anyway, I kind of woke up feeling a little melancholy about that. And I don't mean to be a downer. I want to be as positive as I can possibly be. And I am positive. I'm an optimist. That's why my magazine is called The Icy Optimist. But we got to be real here. We got to be real here. This is tough. This is hard. You're working damn hard right now to get through the day. My favorite, I love watching medical shows on TV, which is crazy. Like my favorite show to watch is Dr. Pimple Popper. I don't know why. I just love watching her. I think it's fascinating. And I've just started watching My Feet Are Killing Me, which is follows real life podiatrists. And holy hell, that is grisly at times. I can barely watch it. I'm like going, oh, oh. And usually I can watch surgery, but I have trouble watching that surgery. But so I was watching it last night, and the other thing that really came to me is the fact that we always have to remember context. Yes, you're up all night. Yes, you're crying. You're sleep deprived. You're exhausted. I get that. I've been there. I know exactly where you are. But until I started my first support group, I thought I was the worst patient ever. I was absolutely convinced I was the worst patient who had ever had IC until I started my support group. And then I started meeting other patients, and it was like, oh, you know what? Mine really isn't that bad compared to some other people. And that gave me the benefit of context. And that's what the show My Feet Are Killing Me, it reminds me of, and that is context. Because we can walk, we can function in many ways. We don't have we haven't been like, there was a guy with Proteus syndrome, and his feet were completely disformed. And all he wanted to be was a soccer player, and he would never be a soccer player. And I thank God that he's got a loving mother, and thank God that he has doctors who care for him. But I also am like, thank God that boy, that's a burden. That's a really, really hard burden. So we all have our own challenges in life, and we all have our own idiosyncrasies and all that sort of stuff. So anyway, you are an anatomical mystery to be solved. If you are not responding to therapy, if you are getting worse rather than better, it is time to open some new doors. That was what the American Neurology Association says. It's time to take a step back and revisit the diagnosis. This woman spent years doing bladder therapies that would have never helped her. What would have helped her is nerve blocks and muscle therapy. And that's what we've got to do. Okay, now somebody asked, why do you have bladder sensitivity if your problem is pelvic floor? So understand, let's talk about the pelvis here for a moment. Let me get my diagram. My model. So understand here that the pelvis is the center of the human body, right? So what does the pelvis do? It carries the greatest weight in the human body. The human body is designed based upon the size of the bones. The bigger the bones, the more weight that it's meant to carry. And so obviously the pelvic cavity carries the weight of our torso, but it also deflects the stresses when we're walking and running, right? So if you stumble, the forces and pressure of that stumble will come right back up your legs and right into your pelvis. Your pelvis has critical muscles in it. Muscles not only to support your organs, but muscles that play a role in you opening and closing your legs, right? And inside your pelvis, we have a reproductive system, right? We have a bladder. The bladder goes in here. We've got a bowel. The bowel goes in here. And then we have got nerves that come off the spinal cord, right? And they come through those holes. Oops, my bladder fell. Oops, there it is. So in this very complex cavity, there's a hell of a lot going on. So we got nerves that come through the sacrum, through these holes in the sacrum. They come down through muscles and go down to your legs, as well as innervating your crotch. And of course, we have blood vessels. And modern medicine fails the pelvic pain patient in a sense because of the way doctors are trained. Doctors stay in their box. Urologists like to stay in the urinary tract. Gynecologists like to stay in the reproductive tract. Gastroenterologists like to stay in the gut and the bowel. And they don't necessarily focus on relationships. How does everything in here influence each other? So there are two fundamental reflexes in the pelvis that you should know. The first one is really interesting, and that is, can an organ like the bladder change muscle behavior? So, here, hold on. Uh oh, where's the rest of my bladder? Okay, so here's a bladder. All right, so can the bladder right here change the behavior of these muscles? The answer is absolutely. If you're in pain, your muscles are going to get tight to protect you from that pain. That's called the guarding reflex, right? That's how your body is wired to protect you. So if your bladder is screaming in pain, I can promise you your muscles are going to get tight to protect you. So that is called the viscerosomatic reflex. And so let's say you're going through chemotherapy, or let's say you've got a UTI, or let's say you've got a kidney stone or a bladder stone, and your bladder's screaming. You have to understand your muscles are going to keep getting tight and tight because that's the way it's wired. They're trying to stop you from moving so much to hurt it. But the other question that's the even more important question is can muscles change the way the organ behaves? And the answer is yes. So these are the patients whose symptoms began after some sort of physical trauma, car accident, a fall, a history of abuse, a history of athletics, something like that. Falling on your tailbone is classic. So let's just say you're taking a walk and you just fall on your tailbone. You get up, you wipe yourself off, you kind of pat yourself dry, get all the dirt off of you. And you're kind of going, okay, that hurts a little bit, hurts a little bit, or it might even hurt a lot. And you walk it out, and maybe a couple hours later, you're not feeling it so much. But the next day, you wake up with frequency urgency. It's like, what? Where'd this come from? You call your and you say, hey man, I think I have a bladder infection. Can I have some antibiotics? Doctor goes, sure, let's throw you some antibiotics. They don't work. The doctor back, and the doctor goes, oh, we better culture your urine. Let's see what we got. They culture your urine. Here you've got frequency urgency, maybe even pain. They culture your urine. It comes back negative. You're like, what? But I'm up all night peeing. And the doctor goes, well, let's just give you antibiotics anyway. We do another round of antibiotics, maybe a third round of antibiotics. They don't work. Your doctor then sends you to a urologist. And the urologist goes, you know what? I think you might have overactive bladder. So they give you an overactive bladder medication like ditropan or Detrol, and you do those for several months. But you're never better. It's still there. You go back to the doctor. Let's say you have a wicked flare. You go back to the doctor. Doctor, what is wrong? The doctor goes, God, I hate to say it. I think you've got interstitial cystitis. This is terrible, incurable bladder disease. Let me give you the diet. Get used to it. You got to live with it. And you're like coming online and you're reading all about IC. You might even find me and you're going, oh my God, this is awful, awful, awful. But we have to remember context, right? Any good doctor today at your very first appointment would be checking your muscles. Very first appointment. Because muscle tension, an injured muscle becomes a tight muscle. What does a tight muscle do? It starts to squeeze blood vessels. And when you squeeze the blood vessels supporting the bladder, what happens? The bladder can't be healthy. We get ischemia. Hold on. Okay, we get ischemia, oxygen deprivation. So not only is the bladder now getting limited blood supply, it's also getting limited nutrition. It's very hard for the bladder wall to be healthy if it doesn't have good blood supply. And then, God forbid, you have trigger points from that original injury. The trigger point is a long term compression injury that also damages more blood vessels and starts damaging nerves. And so, the operative question here is, can muscles, or more importantly, a muscle injury, change the behavior of the bladder? And the answer is yes. And that is why you are bladder sensitive. You might be diet sensitive if your number one problem is tight muscles. It's the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? They're both involved, but one is normally driving the other. For some of you, it starts with a bladder injury. For others, it starts with a pelvic floor injury, but they're both involved to a certain degree. So we got to address both of them. You can't just treat your bladder and ignore your muscles. Listen, if you can't start your urine stream right away, if you're sitting there 5, 10, 15, 20, 30 seconds before you can relax enough to empty your bladder, you've got tight muscles. It was a gentleman I was working with last week. It was interesting. Like he seriously couldn't pee right away. Why? Well, for a guy, there's two things we're going to look at. We're going to look at benign prostate hyperplasia and tight pelvic floor muscles. And in his case, his prostate was normal. It was tight pelvic floor muscles. And that's what we see in, remember in 2008, we had our first pelvic floor physical therapy study that proved that muscle therapy outperformed bladder therapy in the great majority of patients. And that's what turned the IC movement on its head, because up to that point, everybody considered IC a bladder disease. We don't think of IC as a bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because we now know that structures outside of the bladder can be triggering all of this for you. Fibroid tumors, endometriosis, Tarlov cysts, pelvic congestion syndrome, tailbone injuries. There are lots of potential things that can be triggering the symptoms that you have right now, including bladder symptoms. So your job is to kind of rule them out. Here, let me have a drink here. This is what we sell in our store. This is our pumpkin spice rooibos tea. Now, I can't drink coffee anymore. And I used to love chai tea. Can't do chai tea or any black tea or green tea or white tea for sure. But this herbal tea is fantastic. Let me show it to you. Oh, it's in my kitchen. I went through my supply. Anyway, if anybody's looking for a really cool, very gentle herbal tea, but that's very rich and flavorful, come on over to our website, IC Network, and go into our shop and look at our teas. Patricia, hello from Montreal. Carla, let's see. Okay. So Sherry, I hope that answered your question. That's why if you have pelvic floor dysfunction, certain foods will hurt. And also, hon, you got to consider aging too, because your bladder is going to change as you get older anyway. So once you're in your 40s, or if you've had a hysterectomy, you're in surgical menopause, your bladder also is going to become more vulnerable because of the loss of estrogen. Kathy said, is there a probiotic that doesn't flare you? Yogurt kills me, but I have IBS, so I need something. So that was one of the mysteries of IC that somebody finally answered for me earlier this year. And that is, why do some patients flare when they eat probiotics? And it turns out that some strains of beneficial bacteria provoke a histamine response. A strong histamine response. And that is why some patients flare when they take a probiotic. And so I can tell you that Natural Approach Nutrition, which is the company that makes Bladder Builder and Bladder Rest and Bladder Smart, is actually working on a bladder-friendly probiotic. So, hi, Kathy, in the meantime, you're just try to look at the yogurt and write down the strains, and then try to find a yogurt with different strains. And I did an article on this. I don't remember the 3, but we listed the strains that are the most bladder friendly on our website. I just don't remember what they were off the top of my head. Okay. And guys, I hate it when this happens. Cystoprotec, we will not be able to get until April. I placed an order for 75 cases a week ago, and guess what? They forgot to reorder it. So it's going to take them 3 months to make their next batch of Cystoprotec. So Cystoprotec, there's, I think, maybe 100 bottles left on Amazon. And we have a small handful on our website. And once they're gone, they're gone. If you get automatic refill for Cystoprotect, 2 bottles every 2 months, we have enough to do that for a couple of months for our recurring customers, but we will not be able to send out new bottles of Cystoprotect to anyone. And remember, we're the only national seller, and they were greatly embarrassed that it didn't get done. It was a distributor error. So what can you do instead of Cystoprotect? Well, obviously we've got Bladder Builder and Bladder Rest, which we've talked about tremendously, but some people still like the Cystoprotect formula. I have a new one. So this is the one we're talking about, right? Cystoprotect, manufacturer's delay. So look for this one, Cystomend. The exact same ingredients, actually 5% more or 5 milligrams more. I don't remember. I think it's 5 milligrams more of the critical ingredients. Same ingredients, same in the olive kernel oil base, but they added pumpkin seed extract for an additional antioxidant effect. And so Cystomend is the closest we've got that matches the formula of Cystoprotect. So I put in a rush order for this to try to get more of these for those of you who use it. Because I know I'm going to have people calling and crying, going, "Where's my Cystoprotect?" And this is why you always, always, always have an extra bottle or two on hand for things that are really important, because you never know when manufacturer's delays are happening. We also have a manufacturer's delay with Cysto Renew. So your best act in town, if you're going for the supplements, is going to be Bladder Builder or Bladder Rest or Allopath or Cystomend at this point in time. Somebody's talking about Activia yogurt, and the Activia yogurt is the one yogurt that doesn't cause flare-ups. You know, what's so interesting about that is I can't do Activia. It makes me very gassy, and I think it's because of the inulin in it. Georgia says, if I take Desert Harvest Aloe that has calcium carbonate, can I take Pre-Leaf with quercetin plus aloe? Well, you know, you don't eat calcium like candy. You don't eat Pre-Leaf like candy. Calcium's got to go somewhere. And if you eat too much of it, it's going to end up in your bloodstream, end up in your kidneys, and it's going to form kidney stones. So I wouldn't go over the top and start doing maybe a lot of Pre-Leaf on top of the other calcium supplement you're taking. Okay. Kathy says, I'm on a low residue diet and fiber is evil for me. So Miralax it is. So, hey, Kathy, where is it? Where is my, here it is. So it's all up. And when you've got irritable bowel, you've got to remember that the nerves in your body and the nerves specifically in your bowel are extremely triggerable, and they will be irritated if you eat a lot of rough things like granola. So people with IBS generally don't do well with what we call insoluble fibers. I don't do well with insoluble fibers. We need soluble fibers, fibers that dissolve in water, fibers that are gentle. And so the fiber that we have all been relying on for the last 20 years is Heather's tummy fiber, which is an acacia fiber, which is very dissolvable in water. And in fact, that is what is in this right now. Look, you can't even see it. There's no particulates in it. It dissolves nicely. Right. And so Heather's tummy fiber is a great way to get a nice, soluble, gentle fiber. Okay. They have a fabulous website, helpforibs.com. Heather and I are friends. There are 3 of us who each started different groups. Kathy started Hister Sisters. I started the IC Network. Heather started the IBS group. And it's so interesting watching us over time, how we've changed. Because Heather early on created products, and they were fantastic products. And so this is really her baby, and she's done a fabulous job with this. We also have, I've never used this, Regular Girl. It's a prebiotic fiber and a probiotic blend that quite a few people rave about. And it has bifidobacterium lactis in it, in addition to the fibers. So, and it's guar fiber, which I do believe is a soluble fiber. So anyway, so there are two good fibers for those of us who struggle occasionally with constipation. I'm willing to talk about anything, including constipation. Here, give me one sec. All right. Okay. And Pamela is saying desert harvest sallow helps stop flare-ups. Great. Great. If the desert harvest sallow is working for you, go to it. Power to you, my friend. We don't carry desert harvest anymore. We carry an aloe product called Aloe Path, which I like better because it also has a pain reducing ingredient in it called PEA. Roxana says the best diet for me is no gluten, no sugar, no lactose. I mean, we can't make broad statements. Not everybody has lactose issues. I mean, I don't have celiac disease either. I don't have classic gluten disorder. But what I can tell you is I feel better when I go very, very, very low gluten. Like literally the only bread I eat is Ezekiel bread. It's really rare that I do white noodles, but I did that a couple of times this week, and hence the swelling in my belly. Okay, and somebody is speaking Spanish, and I'm sorry. Oh, okay, I can see the translation here. Hold on a sec. Daniela is from Modena. Daniela, we're just talking about IC, and I'm taking questions about IC, IBS, Vulvodynia, etc. You guys, you're so sweet. Thank you for your kind words. All right, hold on. I have to look at a translation here. 5 years of Spanish, and I still don't read Spanish well. Marcella, thank you so much for the 50 stars. I really appreciate that. You guys, if you find us helpful and you're on Facebook, you can actually give me stars, like my piano teacher used to give me whenever I played a song right. Shanna says, tailbone cracked, car wreck, overactive bladder, possibly IC in my 20s, hysterectomy 41. I left with one ovary, endometriosis, 1-inch hole in bladder after. Holy hell, you had a 1-inch hole in your bladder after a hysterectomy? Woo! That's what we would call a surgical error or a surgical complication. Now 51 came back with a vengeance. MRI does show L4, L5, S1 disc bulges and facet hypertrophy and abutment of the existing L5 nerve. Yeah, but honey, Shanna, you got to look at estrogen atrophy too. You've had a hysterectomy and you have estrogen atrophy for sure. And that's absolutely going to affect the health of your bladder, hon. Your bladder relies on estrogen to produce that nice thick coating of mucus that normally protects it. Remember, your bladder is like your mouth. It's a hollow organ covered with a really thick coating of moisture. And the purpose of that moisture is to act as a barrier. It protects the skin underneath it. Unfortunately, it is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus and you can get away with a lot of stuff. When you're older, you have much less estrogen, much less mucus, thus your bladder cannot defend itself. That is not a disease, that is aging. So you guys, for women who are older, look at genitourinary syndrome of menopause, GSM. Catalina says she can translate Spanish. Catalina, that's awesome. That's awesome. Thank you. Catalina, we really do need to create more Spanish materials. And I've had several people volunteer. If that's something you would be interested in, please email me, icnetwork@mac.com, and I'd love to get some help on that. Hi, Linda. Hi, Elle. I have endo, what feels like type 1 IC, which would be Hunner's lesions. I have endometriosis on my bladder and mild bladder symptoms after my laparotomy, but my bladder symptoms became so much worse. And I was diagnosed with IC 3 years ago. I've been in severe pain, urinating up to 40 times per day. Nothing has helped my bladder symptoms. I've tried the meds, supplements, instills. Diet helps a little, but I'm exhausted. And afraid I will one day be homeless because I can only work part-time. Girl, I understand exactly where your head is because that's who doesn't have that worry? Even I still have that worry, even though I'm better. It's amazing. So if so, you had endometriosis attached to your bladder. You had a laparotomy, and immediately after the laparotomy, your bladder symptoms got worse. Did your bladder get damaged during the laparotomy? Um, you know, I attended the International Pelvic Pain Conference in October. And the case study they used for 3 weeks was a woman who started with endometriosis, and then a couple of years later, she got IBS, and then a couple of years later, she got IC, and then a couple of years later, she had multiple pain conditions. And the context of that is something called central sensitization, or chronic overlapping pain conditions. That sometimes what happens is that the nerves in the area become extremely sensitive. You know, you've had painful periods for years, then you had a laparotomy, they removed endometriosis, you might have adhesions in here. And so, what's the ripple effect of that? The ripple effect of that is number one, your muscles are going to be tight, and your muscles are probably chronically tight because you probably have had tight periods for years, right? So, we know muscles are probably going to be pretty worked up. And that then is also going to work up the nerves, which could then explain why your bladder symptoms are a little bit more funky. But you know, um, I have to wonder too if they put you on Lupron. Did they put you into a chemically induced menopause? If they did, then the reason why your bladder would be so sensitive is because you simply don't have enough estrogen to produce that nice thick coating of mucus. If your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. So, Elle, we got a couple of things that are worth talking to your doctor about. Number one, was your bladder injured during the surgery? Number two, what is the health of my pelvic floor muscles? Number three, what is the health of the quality and health of my skin? And could this be being driven by just simple estrogen atrophy? And if I had to guess anything, I mean, it's hard to say. You say nothing has helped your bladder symptoms. You've tried meds, supplements, instills, physical therapy. Diet helps a little. So, if diet helps a little bit, that does point us a little bit more to the bladder wall. But I would want to know, are your muscles tight and what the quality and health of your skin is. Marcella says, if your IC isn't bladder wall driven, is soda okay? No, it's not okay. Hun, we're getting, I mean, listen, our bodies were designed for life thousands of years ago when they didn't have soda. The daily acid load of soda and the preservatives and the artificial colorings are going to take a toll on your body, especially as you get older. So I don't think soda is healthy for anybody, especially Mountain Dew. Did you see, gosh, who was it? It was like Jane Pauley years ago did an issue on teeth in Appalachia, and that basically parents, because Mountain Dew was cheaper than milk, that parents were putting Mountain Dew in baby bottles and feeding it to infants and young children. And literally their teeth were their teeth were destroyed. So I'm not a soda drinker at all. I've had 2 sodas in the last 10 years. One earlier this year during the fire, a little thing of 7 Up. I'd rather do sparkling water, get some LaCroix water. There's no residual acid in that. Gabby says, what happens when you have IC and pelvic floor and you did months of physical therapy made it worse? Now you're doing Botox injections every 3 months, but I'm always still tight on the left side. They put me on muscle relaxers and nothing is helping. I try yoga stretches now. They're going to send me to pain management. So Gabby, okay. This, guys, for everybody watching, every single person watching, get this book. It is a life-changing book, especially if you have a history of pelvic trauma or you've had injuries of some type or surgeries of some type. So Dr. Jerome Weiss, the author of this book, took him 15 years to write this. He was a pelvic pain specialist here on the West Coast. He's retired now, but this is a love letter to patients, and it is designed to give you more doors to open if you're not responding to therapy. So Gabby, in this book, what baffled him? So he was a urologist who saw very quickly back in the 70s that bladder therapies didn't help the majority of patients. And so he looked beyond the bladder very, very quickly. And he transformed his practice into a muscle practice, a myofascial practice. And so if you went to his clinic and you had tight muscles or trigger points, you would walk out feeling better. He was a master at manipulating muscles. He was a master at finding where in here the muscle problem was, and you would walk out feeling better because he could get rid of that trigger point for you. But what baffled him is, why did it come back a week later, 2 weeks later, a month later? Why was there muscle tension in exactly the same spot? And why was there a trigger point in exactly the same spot? And that's when you look beyond the muscles to the bones, my friends. Because if there's a problem with the bones, that's going to put pressure on specific groups of muscles. And this is really where a good portion of mine are, because I have constant left side pain, and my left side pain is coming from my SI joint. My SI joint is very flexible. This is a joint. This is where the hip bone attaches to the sacrum. So like right there, that's the SI joint. And normally muscles help stabilize this, but this is a very firm, rigid joint. It's not meant to move. If it starts moving, there are issues. Mine moves. And so my piriformis muscles are constantly tight because they're working really hard to keep this joint together. So Gabby, the fact that physical therapy made it worse tells me, I always say that if you go to pelvic floor physical therapy and you have a pelvic floor assessment and they touch a muscle and trigger your pain, we call that the hallelujah moment. It's like, oh my God, that's it. What are you touching? What are you touching? That's it. You found it. So the fact that physical therapy hurt is actually kind of encouraging, because that means that manipulating muscles triggered a flare. Okay, so then that means your symptoms are being driven by muscles. But it also means that the person who's working with you is probably not as skilled as they need it to be, because physical therapy really shouldn't hurt too much. And the fact that you're still tight on your left side means that you really still have to work on that. So if you've got one leg longer than the other, if you've got a bad hip, a bad SI joint, a bad knee, a bad foot, that could explain why you're always tight on the left side. And so Gabby, please, I encourage you. You need to get this book so that you can really understand the connections here. And seriously, my friends, it's free on Kindle Unlimited. No excuses. You can sign if you have Kindle, and I have Kindle, and I have Kindle Unlimited, so you get 10 free books at a time. And you can sign up for it for a month for free. So sign up for it for a month and get the book and at least read it. But a lot of people prefer the paper version. I do because as you can see, I highlight areas, right? And so the paper version on our is in our store for $29. On Amazon, it's $36. Marcella says, does Botox help? I'm scared. I have frequency and constant urgency. Botox is a step 4 treatment option in the AUA IC treatment guidelines. So the reason why it's in step 4 is because there are some significant risks of adverse events, specifically if they actually accidentally turn off the nerve that controls urination, you might have to self-catheterize for a period of time. So come on over to our website and read about it. Go to icnetwork.org and go to the treatment area and read on Botox, okay? It's viable, but it comes with risks. Becca says, would emotionally traumatic, physically vulnerable experiences impact pudendal neuralgia as well as past physical trauma? Well, listen, whenever you're under stress, your muscles get tight. You know, that is a stress response. That is a fight or flight response. And so when you're under stress, your muscles are going to get tight. And if you got pudendal neuralgia, the odds are your pelvic floor muscles around your pudendal nerve are going to get tight, and that's going to trigger more pudendal neuralgia. Julie says, I fell down some stairs on my ass 15 years ago to the point that I have a dent in my left cheek. Just recently realizing this could be the cause of many things. 100%. 100%. We absolutely want to look at that trauma right there. And I would really want to know what the dent is. I mean, that's important. What is the dent? Is it a damaged muscle? Is it a damaged bone? We got to figure that out. Jill says, why do pelvic floor dysfunction symptoms come and go, maybe from 1 week to the next? It seems like if you have tight muscles, those muscles would be tight until they're manipulated with therapy. No, because if you listen to great music and you just chill out, your muscles are going to get tight. I mean, going to get relaxed. So pelvic floor tension is driven not only by bony structure abnormalities, but it's also triggered by stress. And so there are going to be some weeks when you're going to be feeling really good and feeling really, really relaxed. And there are other weeks when you might be really stressed out and your muscles are going to be pretty tight because of that. My muscles, like 2 weeks ago, holy hell, they got super, super tight. And for me, when my pelvic floor muscles get tight, it's a pulling sensation. It's like there's a hand up my vagina that's trying to pull my bits out of my body. And as soon as I feel that, I have to get out my wand and I've got to work on it. And where's my wand? My demo wand has disappeared. Where are you? Huh? Where is it? Is it here on my desk? It must be here. Wait a second. Hold on. Did I not put it away after my last meeting? Huh. Well, anyway, we sell glass wands that you use in addition to your finger as you're trying to work out muscles. And I think what's so interesting for me is while my pain is physically on my left side, my muscles are the tightest, are often get the mushiest. God, how do you explain? You know, muscles are normally flat, right? You can see how flat these are. So the muscles are a healthy, relaxed muscle is fairly flat. A muscle that's tight gets like this. It gets thicker and shorter. And I find it very, very interesting that there are moments when it's my internal right pelvic floor muscle that is the most messed up. But when you work with it with a wand, it gets better. Hey, Shannon. Sue, I went to a new urologist last week. I didn't mention IC. I gave symptoms only. I had 3 bacterial infections since November. I bought the Microgen test, took it in with me. They refused. They don't believe in it. It ended up, she told me I had IC and they want to do installations of steroids and lidocaine, which I've had before. I have no idea what to do now. I had most treatments and meds for IC. Elmeron helped but caused eye issues, and you lost your vision in your left eye. Hmm. So, well, what did your next generation test show? What did they show? Did it find anything? Georgia says, does vitamin B12 cause flare-ups? Not usually. Not usually. Sue said that she used this regular girl and it worked for her. Georgia says, how do you spell allopath? The way you spelled it right there, allopath. Let me get it. Allopath. Let's see. Oh, the discussion wasn't in Spanish, it was in Italian? Oh, my apologies. My apologies. You know, the Italian, Italy has had a very active IC research community and patient community. What is the name of the lady who runs that? I've only met her a couple of times. I can dig that out for you if you want, or just come on over to our website and go into our support area and go to the international groups. Jill said, I was in a motorcycle accident when I was 16, landed on my stomach, was very sore, had internal bruising, healed fine. Curious if that could be a contributing factor. Absolutely. Absolutely. Carrie said, what do you do if you prefer to sit rather than standing or moving around? If your symptoms are being driven by movement, again, we're going to look at muscles. Or the other thing that we would look at, another lady I was working with she was so dry. She was 82. She was 82. And she was on estrogen, but it just wasn't enough for her. And her tissues were so dry that moving hurt. And so that's when we pull out the coconut oil and almond oil and things like that for moisture. Michelle says, what is vaginismus? Vaginismus is chronically tight pelvic floor muscles that make sex painful. Nanette says, can you please explain what vulvodynia is and for getting a biopsy? Yeah, sure. So I had vulvodynia for about 7 or 8 years. So from like 18 to like 25 or 26. Hi, Kath. So vulvodynia means that you have pain on your vulva. That's kind of unexplained. Vulva means vulva, dynia means pain. So vulvodynia. The way it felt like to me was that like somebody had scrubbed off my skin with sandpaper down there. It felt like a really bad yeast infection. But whenever I went to the doctor was like, you're fine. There's nothing wrong. There's no yeast. You're a redhead. You have the most sensitive skin I've ever seen. That's exactly what Dr. John Renfrey said to me several times when I was a teenager. The vulva can be impacted in several different ways. We're going to see vulvodynia in people who are older or who have estrogen atrophy because the skin is meant to be moist, and if it's dry, it's painful. We're going to see vulvodynia in some people who are reacting to chemicals, like if you use a certain laundry detergent or fabric softener that's irritating your skin. Or if you're using a bubble bath, or if you're using a harsh, aggressive soap like Dial soap, that skin is meant to be moist. You're not supposed to scrub it. And if you scrub it and you break through that moisture, you've now exposed the skin to whatever chemicals it's being exposed to. The other thing that we know that can really trigger vulvodynia is going to be tight muscles. So this is the levator ani muscles, right? So these are the muscles that basically go right here. And the levator ani muscles have 3 holes in them. So they've got a hole for in a woman for a urethra, for a vagina, and for a rectum. What was really interesting for me when I had vulvodynia is the hot spot was right here on the perineum. And I didn't really understand that. I didn't understand why the perineum was by far the most sensitive. And guys, I had vulvar biopsies. I had everything. Believe me, they worked really hard to figure it out. And again, it wasn't until I read this book that it explained why that perineum can be so hot and bothered. And that is because, let me see if I can get a picture here. Here we go. So here is the picture, but it's showing the muscles. And if you can see right here, there's a little bundle. It's an attachment point for 4 muscles. So immediately above the perineum, above the skin, so above this area, there is an attachment point for muscles. Well, actually, this shows the muscles. And if you could look at it up close, it actually shows the muscles going in the different directions that attach right here. So in many cases, vulvodynia is caused by tight muscles. And of course, the other thing we want to look at too is tight nerves. Nerves. So if you ever have pins and needles on your vulva, then we're going to be looking, or numbness, or again, persistent genital arousal disorder, things like that. We're going to definitely be looking at nerves, and are the nerves being impacted and traumatized by tight muscles, okay? Listen, if you got vulvodynia, let me grab this book here. This is a great book, The Vagina Bible, by Dr. Jennifer Gunter. She is a pelvic pain specialist here on the West Coast. She's very active on Twitter. She really has a mouth on her in a great way. She's very independent, proactive, assertive, doesn't let anybody mess with her. So she's not afraid to take somebody on. One of the chapters in here that's so good is the chapter on soaps, cleansers, and wipes. So you can get this on Amazon. We couldn't sell it. I don't remember why. I could have sold it. I would have. But anyway, anybody with vulvodynia, if you're getting older, well, no, not even if you're getting older, this is the book. This is the book. It will give you the yes and no's on birth control, on soaps, on detergents, on sex, on pregnancy. You can find all of that here. Okay. Great, great book. In fact, buy it for all the girls in your family. So Donna says, I have clitodynia as well as vulvodynia, allodynia as well. Right. So, it's interesting. We talk about that because now, see, that's not a real name, obviously, and neither is rectodynia. So I don't have vulvodynia anymore. But what I will tell you is my legacy of that is my nerves down there are super, super sensitive. And my rectum in particular can be really touchy. So Donna, did you like the book? Did you find it useful? Marcella says, I don't go see my urologist again until March. They gave me oxybutynin to take. I have frequency, urgency all the time. Started in September. I don't know what else to do. You've been to pelvic floor therapy. They said nothing jumped out at them, so I don't know if I should continue. My gyne said I had a yeast infection called Candida glabrata. It's been around for the same amount of time, but I have no symptoms from it. So, but you're having symptoms, hon. You're having frequency, urgency. You can have Candida glabrata in your bladder. Listen, guys, Candida glabrata is a brutal yeast infection. I had it for 2 years in my vagina, but also on my skin and in my urinary tract. Candida glabrata can be incredibly drug resistant. And it was our own National Institutes of Health who discovered 5 or 6 years ago that some people are flaring because they've got Candida infections in their urinary tract. So, Marcella, I will tell you that Candida infection was probably the most painful infection slash pelvic pain I'd ever had. Um, it was brutal, absolutely brutal. So much so that if you look at the Center for Disease Control website, on the top 10 drug-resistant pathogens threatening mankind, 9 are bacteria, and then 1 is Candida. Systemic Candida infections can be fatal. They're very common in hospitals. So, Marcella, it would be fascinating to have a next generation urine test to see if you have Candida glabrata in your urine. You could. Come on over to our website and go search for Candida, and there's a blog in there that gives the National Institutes of Health research. And they've now found 13 different fungal species in the urine of patients with IC. And generally what they find is that the more the fungal species you have, the worse the pain. You're starting to wonder if anxiety, come on, listen. Now listen. Stop beating yourself up. You've done nothing You've done nothing wrong. That's how we started this meeting. No shame, no blame. Hon, you're having real symptoms. You're having real symptoms of frequency, urgency. You're not doing this. And so, and no, your sensitivity is not causing this sudden onset of your symptoms. We have to look at the quality and health of your skin, the quality and health of your bladder wall. Are you estrogen atrophied? That's important here, because if you're drier, then your bladder's going to be more reactive. So if your vulva is dry and your vagina is dry, then you have to assume that so is your urethra and so is your bladder. So that's one thing we want to know, is what's your skin like down there? And then the second thing we want to know is there any chance you have a Candida infection in your urinary tract? It happens. And again, our own National Institutes of Health are the people who discovered this, and they discovered this like 5 years ago. So go on over to our website, and there's a blog that says, can Candida cause, or can yeast infections cause IC symptoms? And the answer is hell yeah, absolutely. Marcella, thank you again for the stars. She sent 100 stars. Thank you so much. I really, really appreciate it. Kayla says, thanks for doing this. I'm on the Axonics bladder stimulator since July. It really helps with the incontinence and a little bit with the pain. Good. So neuromodulation is particularly helpful for people who struggle with incontinence. IC, incontinence is not a symptom of IC. Incontinence is a symptom of overactive bladder. So frequency, urgency, incontinence without pain. That's kind of the diagnosis of overactive bladder. And that's really where neuromodulation shines. It also shines not only for urinary incontinence, but fecal incontinence. Elle says, no Lupron, just birth control. Yeah, but hon, birth control will reduce your estrogen levels and can trigger all of this too. We just had a research paper earlier this year, a case study of a patient who started birth control, and within 2 weeks, she developed new, sudden, severe symptoms of IC. Over a period of a year, she was diagnosed with IC, with chronic fungal infections, you name it, they diagnosed it with her. And finally, it was the 5th or the 6th doctor who asked her if she'd started birth control, and she said, yeah. They got her off the birth control, and her symptoms went away. A lot of people just don't really understand how remarkably sensitive the urinary tract is to the loss of hormones. Debbie likes this book, Breaking Through Chronic Pelvic Pain. She says, this book gave me such great information and understanding of my pelvic issues. Awesome. The book is Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. Now we've got a couple more books coming, and I'll do the official release for this one maybe next week. We're finishing up the website for it first. Facing Pelvic Pain, a guide for patients and their families, was produced by professors at Harvard Medical School, and I'm one of the authors in this. I was invited to contribute a chapter. And so This book is a dynamo, because it's like the first book that really talks about all the other conditions that can cause pelvic pain, and it's mind-blowingly good. But I'm not supposed to talk about it yet. And then we also have a new book coming out probably in a month or two called IC 101, and that is an IC Network publication. And that's a book I've been writing with Gay Sandler and her husband, Andrew Sandler, who wrote the original Patient to Patient Managing IC. So it's a next edition of her book, but we've massively edited it to include all the subtypes. And so I'm now a contributing author on that book too. Annie says, Jill, do you know when you will get the blue seat cushions back in stock? The blue seat conditions have been discontinued by the manufacturer because of COVID. I do not believe we will ever be able to get those back. So instead, we have the caps cushions, which are more expensive, unfortunately. So let's see if I can show you. Okay. Whoops. All right. So if you have trouble, see, you know, it's not a real meeting with me until something falls. So for those of you who have trouble sitting because you're dry or your urethra's tender or your vulva's tender or your rectum's tender or you've got PGAD, then the cushion that we sold for many years was this cushion. In fact, we had them specially made for us. So they had a groove down the middle so that when you sat on them, each butt cheek was supported, but nothing was pushing up against your crotch, right? Sadly, COVID just decimated the factory and they shut the factory down. So the chair cushions we have now are called caps cushions. And I'm going to tell you right now, they're much better quality than the blue ones. But they're also more expensive. They're in the $60, $70, $80 range. So look, you can see this is their travel cushion. And so the nice thing about this one is look at how easy it is if you're walking somewhere. So it's not, it's really super easy to carry. And you can see it does the same thing. It's got a groove down the middle. And then there's another one that's in the shape of a U. I've got that in another room of the house. So these are the cushions that we have now, okay? We always had challenges with the blue cushion. We always did. Manufacturing challenges with them. Anne says, can you get bladder issues with sciatica? Hell yeah, definitely, because your muscles are tight. So if your muscles are so tight that they're squeezing your sciatic nerve and giving you sciatica, then your muscles are so tight that they're affecting your bladder. So absolutely. Elle just sent 1,200 stars. Elle, thank you so much. I really appreciate that. You have no idea. Guys, y'all got to understand that, a business that gives the great majority of their stuff away, 95% of their stuff away for free, like the IC Network, it's not like we're rolling in the money here. My retirement fund is pretty small, and I'm getting closer and closer. So we really appreciate every membership and every star you can send us. Akela says, I had a hallelujah moment in the ER the other night. Uber found exactly where it hurt. What? What? Kaylee, you got to tell us more. Sherry says, I'm waiting so long to go to physical therapy when the threat of the virus lifts. Should I just wear a mask, chance it, and go? At least here in California, I will say that most of the medical care providers have their shots, have gotten their vaccines. And so I think one of the safest places to be right now is in a medical clinic. Number one, they're not letting a lot of people in. Number two, everybody's wearing masks. Number three, the care providers are wearing masks, and most of them have now had their vaccines. And so if you're in intense pain, I think it's I would consider it worth the risk. I mean, I went and had dental work, and my mom's going to have an infusion tomorrow. My sister had an infusion. KS on YouTube says, "Hi, I have UTI symptoms, but had several negative cultures since November. I've taken 3 antibiotics with no help, and the doctor thinks it's IC. I have pain near my ureters and kidneys. Is that normal for IC? Not usually. We don't have kidney pain with IC, but I have to wonder instead, KS, if you have tight psoas muscles. The psoas muscles are muscles that come up here, and they're big ropey muscles. They're on either side of your spine. And girl, when those spasm, it hurts like hell. I have when my psoas muscles get tight, I will be wearing 3 body heating pads up my spine as I'm trying to get them to relax. So I mean, we got good news here. Okay, so concept number 1 is that you got negative cultures. Concept number 2 is, I would really want to know, since you seem to have pain near your ureters and your kidneys, is there any chance you have kidney stones? That's important to rule out. And then I think the next thing to rule out is, do you have tight muscles? But I quote, that's not quote unquote IC. Ureter pain, kidney pain is not associated with bladder pain to that degree. We don't see that in most IC patients. I never had kidney pain. I did have low back pain from tight muscles, though. Julie says, my chiropractor says my hip moves forward and locks up. It literally feels out of place. So, Julie, here's something that's just so incredibly interesting. And that is, we had a research study come out this summer that showed that 70% of the men with testicular pain in their testicles, 70% had an underlying hip dysfunction. So we're getting much better now about understanding how orthopedic issues, bony structures and muscles can cause crotch pain, bladder pain, testicular pain. Here, Denise on YouTube just said that she got Candida in the hospital. Yeah. Julie, thank you so much for your stars. I really appreciate that. Elle says she uses the glass wand. She uses the Thera wand, and it helps to relieve tension. Awesome. Ruth says, good question about physical therapy. I'm scared and have been procrastinating for fear it will make things worse. Now listen, Ruth. You can't let fear stop you from having an appropriate diagnostic workup, hon. It's important that you give somebody an opportunity to study your muscles. Because if you don't, and this is muscle driven, you could spend years doing bladder therapies and never get better. And remember, the purpose of when you go for a pelvic floor assessment, they're going to just study your pelvis. They're going to look at your back. They're going to look at your core. They're going to look at your legs. They're going to look for muscle tension patterns. They're going to watch you walk up and down the hallway, see how you're walking. And then they're going to do an internal exam, and it's super easy, no sweat, nothing to worry about. They're very kind. They're very gentle. They tell you exactly what they're doing. And for a woman, they're going to do it vaginally. For a man, they're going to do it rectally. And you can see, so this is what happens when a finger is in your vagina. They're just going to touch muscle groups. And see, look at how far I can get. I can get all the way up here, right? And that's what they're doing. So they're touching these groups, and they just want to know, do they feel normal? Are they tight and bunched up, or are they flat? And this is where your hallelujah moment happens. Because if they can touch something and trigger your pain, woo, it's like, all right, that's it. What are you touching? Please tell me what you're touching. Here, guys, hold on a sec. Hi, hey, I can't say your name because I'm doing a live support group meeting right now. Are you trying to get into the support group meeting? I can't. Yeah, I can't do it right now. But if you come onto Facebook or YouTube, you can come ask your question. We're going to be doing our Zoom meeting in about 10 minutes, okay? Okay, bye-bye. All righty. Hey, man, what other support group will answer the phone on a Sunday, right? Emily says, is Allopath a daily vitamin? No, Allopath is an aloe supplement. So it's got aloe and PEA in it that's calming and soothing. Emily says, what's the wand? The wand is a glass wand that you can use internally to work on your muscles. Oh, here it is. I have two. I have an empty carton. All right, this is what the glass wand looks like. It was right here under my nose. So this is the one that we sell, Easy Magic by IC Relief. This is a company that was started by an IC patient 20 years ago. So we try to, hey man, we got to try to support each other. So, but this is the one that, this isn't the one that I actually use. This is the one I do use. This is a perfect design because you can see when you do it vaginally, you can see how easy it is to just follow the muscle groups. And yeah, I know, guys, listen, I know that sounds freaky. Like, who would want to do that? But it's amazing how successful it is. It's hard, though. You have to learn how to use it. You know, it takes time to kind of figure out. And the first 6 months, you're just going to be, I don't know what I'm doing. But, you know, you can, like my physical therapist kept telling me it was a J shape. I was supposed to move it in a J shape. And I didn't understand that. Now I do with this. You can see, look, it is a J shape, right? See, that is a J shape. It is a J shape. And so the wand will let you go deeper. It will let you go far deeper than your finger. And I'm telling you, we had our first big research study in 2008, National Institutes of Health multi-center study, which absolutely proved beyond a shadow of a doubt that myofascial massage was remarkably successful at reducing the symptoms of IC, better than bladder therapies. And that's a study which basically put the IC movement on its head, because that was the point. That was the point that everybody had to go, uh-oh, maybe the muscles are involved too. Hi, Denise. Denise says, I'm not talking with you. I am, hon. You guys are just pretty quiet. So let me look at YouTube here for a second. I'm sorry, YouTube. You guys, you know I love you too. Okay, so I've already answered all the questions on YouTube. Wait a second. No, I missed one. Donna says, is your hair down to your waist now? Yeah, it is. See? COVID hair. Well, a couple more inches. You watch. I'm going to stun some of you guys and come back with my hair right here. I'm not going to get my hair done for at least another 6 months, though, unless I can get a family member to cut it. But not a 98-year-old or a 91-year-old. That would be bad. Lisa said, does a bladder biopsy showing increased mast cell production mean anything toward an IC diagnosis or treatment plan? The answer is yes, absolutely. So, you know, let me get this. See? Like I said, it's not a meeting with me until I start dropping things. Okay. So let us use our handy dandy educational card from Elmeron. Okay, so here we have a 3-dimensional view of your bladder wall. So the blue area is your protective coating, and no, it's not really blue. It's clear. But you can see you have an outer coating of mucus that protects, that repels whatever's in your urine. Bacteria, irritants, caffeine, whatever, acids. If you've got a nice healthy coating of mucus, it's going to keep all those away from irritating the cells. These are your urothelial cells. You've got 4 or 5 layers of urothelial cells lining your bladder. And these are really amazing because these are the largest single cells in the human body. And if you looked at them under an electron microscope, it looks like a beehive. They're hexagons. And they have something called tight junctions. They're meant to be super, super, super tight so that urine can't get through these cells either. Then underneath that, we've got nerves, and we've got blood cells, and we've got mast cells. Now, mast cells are throughout the human body. And If you were bit by a mosquito, right? So a mosquito would inject poison through your skin or their venom through the skin where it would irritate a mast cell and the mast cell would release histamine. And histamine is what makes mosquito bites swell up and itch so much. Well, you have mast cells here. And so if you've got an injury to your bladder wall and urine or bacteria or irritants are getting here, they're going to be triggering mast cells here. And yes, you're going to have a lot of extra histamine in your bladder that's causing swelling and redness and irritation. Like 20 years ago, the way I used to describe IC is that it was like 100 mosquito bites at once in your bladder. And you got this profound irritating response from mast cells producing histamine. And that's why using an antihistamine is helpful. Because if we can calm this irritation at this level, and the antihistamine is our step 2 treatment option. Generally, we use hydroxyzine, also known as Atarax or Vistaril. If we can stop that process here to stop some of that extraneous swelling and pain, that's meaningful. And in fact, that was a treatment that I did. Generally what they say is if you have a history of allergies anyway, using mast cells appear to be more effective for patients who have bladder issues. And also you're going to notice that you might flare during allergy season. It's very interesting. Sue said they wouldn't do the microgen test because you need a doctor's signature and they refuse. Why don't you see if you can have your primary care provider sign the form, or you can call the company and they can refer you to a doctor in your area that would sign the form so that at least you can. You know, we had a big lecture at the American Urology Association meeting this year where the top IC doctor gave it, and he flat out said next generation DNA urine testing is the future of urine testing. But some hospitals and healthcare providers simply do not support it yet, or they don't want to pay for it, or they don't know how to interpret it. Guys, I am late. I need to start the Zoom meeting. So let me go ahead and start up this Zoom meeting. So the Zoom portion of the meeting allows you to come in and talk with me directly about and tell your story and um, ask questions. I'm going to be leaving the YouTube and the Facebook streams live. They're not going to be able to see your face, but they will hear your questions. So if confidentiality and privacy is important to you, then do not come into Zoom. But if you're willing to let other people learn from your experience, then by all means, feel free to come into Zoom. Why is the Zoom camera? It's so close. It's so weird. All right, so hold on a sec. Let me get you the invitation. Or the copy of the invite link. All right, so hold on one sec. All right, so YouTube, here is your invitation to Zoom. If y'all want to come, if you don't want to do it, that's fine. If nobody wants to do it, that's fine with me. We can keep doing it this way. I'm willing to keep going as long as you guys have questions for me, or until I have pain sitting. All right, Facebook. Now with Facebook, guys, I'm going to lose. Are there any over-the-counter estrogens that would work? Not that I mean, you'll have to Google it. We really have to know why your doctor doesn't want you to do estrogen, and we got to have a healthy respect for that. I mean, if you've got a strong history of cancer, Emily says, how do you get diagnosed with Candida in your bladder? You have a next generation DNA urine test. Okay, now with Facebook, I'm gonna lose some of your questions because I got to go forward. Kimberly says, "Can I talk about the subtypes?" I asked my old urologist about it. He just said a chronic. Just didn't want to listen to anything new. Yeah, I'd be happy to talk about the subtypes. Emily, thank you for your stars. Julie, thank you for your stars. I so appreciate it. Emily sent 530 stars. Woohoo! Elle says the chair cushions really help. Thank you, Sherry, for your stars. Julie says, is it safe to drink baking soda water daily? No, because baking soda is sodium bicarbonate. Once a day, small amount might be okay, but you don't want to be drinking that all day. Anne says, can you use the one for overactive bladder? It wouldn't help overactive bladder. It works with the bladder wall issues. I mean, with pelvic floor issues. Yes. Okay, guys. So Facebook now. Sorry, I had to go through those questions. Let me give you the invite to YouTube. All righty. I mean, that's the invite to Zoom. So with Zoom, so feel free to come on in if you've got a question. I can scroll, Becky, I can scroll up in YouTube easier than I can scroll up in Facebook. But we have to, the mistake I made is I just didn't do it all on Twitch. I should have done it all on Twitch and then we wouldn't have an issue. That was my plan originally. All right. All right. So you guys give me a minute. Perfect time for a bio break. Anybody who needs to pee, go for it. I'll catch you back here in a minute. Okay. Be right back. All righty. Shake it out, everybody. Shake it out a little bit. I wish I could play music, but I can't. Otherwise, I'd put music on. Well, just should dance for a little while, right? Wouldn't it be nice to have an icy dance party? I think that's kind of one of the hardest things about, at least for me, one of the hardest things is that there's a sense of isolation and you get used to being home alone. Denise wants the link for Zoom again. Alrighty. Alrighty then. Okay, so for everybody on Zoom, I'm just going to pick you one time. Don't take it personally. Alrighty then. So I'm gonna go to Eric first. Hello, Eric. How are you doing today? You look great.
Thank you, Joe. As always, I appreciate these meetings and everything that you share. And it's interesting. Last week, we talked about soda. I really cut back on that this week. So
Okay.
but just as a reminder, the thing that seems to flare my pelvic floor issues is when I'm off antidepressants, which I had been. I'm back on them now for about a week and a half. But of course, I'm experiencing pelvic floor issues. Seems like one of the biggest ones is, I guess, what I call that lower abdominal bladder pressure.
Uh-huh.
I see a pelvic floor therapist in Rochester, Minnesota. She used to work at Mayo for like 10 years. She's on her own now. She's very in touch with the nervous system. She has me on a regimen of stretching, walking. I don't really love walking, but yeah, walking.
Mm-hmm.
Those are the two things that I'm dealing with. And of course, I have a super high level of anxiety right now about it. But I can't figure out how. I mean, maybe I can't until the medication really kicks in. But what's frustrating is that whole bladder pressure, like when you press down in that area right above the pubic bone, I guess is where it is. And it's like that feels like, yeah, right down there, just right above the bone. Yes.
Yep.
Exactly. When you press on it, they can feel pressure, and it's just very unsettling, I guess. And sometimes I ask myself, I say, gosh, are you focusing on this so much? Which I am. I'm honestly hyper focused. And that's just keeping things amped up while I try to get the nerves settled down.
Okay. So you're kind of talking in a little bit of a circle. We've got a commonality here, and that we've got the commonality of the anxiety and the nerve sensitization, right?
Yes. Yes.
And when you are anxious, your body, your brain is going to tighten your muscles as a reflex. You can't stop that. That's part of the fight or flight response. So, I want to try to ease your worries here. Okay. Because if we can, like I always say, IC doesn't scare me at all anymore. It's like, I know I'm not dying of cancer. You're not dying of cancer. You're not peeing blood. All that's been checked out. All right. We already know that's all been checked out. You've been under care for a long time. And it's very important for you to remind yourself that about context, kind of in a way. And I'm not saying this the right way. I want to, what's the right way to say this? Your case isn't scary. You have tight muscles. That's not scary. It's just tight muscles, right? And you've got sensitive nerves. Then that's still not scary. I have sensitive nerves. But here's what's a go-to for you. And that is that an antidepressant that calms your nerves helps you. And so you should be getting comfort from the fact that you're doing the one therapy that we know will help calm your nerves, right?
Right.
And so there's no reason to be fearful about that, because you're doing it again. You've learned an important lesson. Antidepressants are very helpful for you. But I do think that, why does walking scare you?
Well, it doesn't scare me. I've never been Mr. Fitness. I just find walking kind of boring,
Okay. So this is where you get a book on tape with your iPhone and walk to a book on tape. We got to get your physical fitness up a little bit.
Yeah, that's right.
That's important because we know the number one side effect of Elavil, aside from dry mouth and dry eyes, is it can make you gain weight and it can make you snack more. It changes that, and so we have to you have to compensate for that by trying to up your physicality a bit, right?
Yeah. Yeah.
So, but what here is, here's the hard question, and you're not going to like me for this question, but it's my job to poke you when I need to poke you. Have you drunk any soda today?
No.
Okay.
No, I did not.
When was the last time you drank soda?
I had a soda last night.
Okay. And what kind of soda was it?
Coke.
Okay. That's what I really need you to stop. I need you to let all of the sodas go. Because the thing now is that the Elavil is going to drive you to drink more soda, and that's just going to create more acid erosion. Here's the reality, dude. You and I are older now. Our body is not resilient like it used to be. If I were having a soda a day with my estrogen atrophy, I would be in more pain. And so you've got a substantially older bladder that really probably can't tolerate it, and your nervous system can't tolerate the caffeine, and that's just amping you up, dude.
Yeah, that's what I figured. I said, yesterday was an okay day. Today's been, I hate to do comparative days, but today was worse. And I said, I drank that damn soda last night.
Right.
Just because and I think, I think for me too, it's always, I have a hard time continuing to sort of embrace my pelvic floor therapist is like, no, you really this is a lot with your nervous system. And hard time going, but why am I experiencing these things? And I try to fight against any sort of functional organ and blah 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 kind of stuff, and I know cognitively that there's nothing that a doctor needs to fix.
I think it's important to focus on injury. At some point in time, you were injured down there, whether it was a bladder injury or whether it was a pelvic floor injury. Is there an active disease process happening? Probably not. Probably not. You don't have Hunter's lesions, right?
Right.
Okay, so you don't have a viral infection. And your symptoms are not consistent with an active disease process. Your symptoms are consistent with chemical injury from the soda combined with the anxiety disorder, just intensifying the pain, which is something we all see. I have the same thing. And so, this is about a new Eric. I mean, you're never too old to change. And you're never too old to become a more physical guy. I think our challenge here is that your nervous system is wound up, your anxiety is wound up, your muscles are tight, and your bladder is sensitive. And so little steps every day. Like if you could, number one, lose the soda, that'd be great. No more soda. Like honestly, for 6 months, you could be a new man in 2 months by just losing the soda. But I would really love to see you every day taking a walk, and just not only taking a walk just to try to, do a little bit of cardio for you, but also just to be out in the healing sunshine, the calming, soothing sunshine, where you can just, practice a little bit of mindfulness that will get you to pay it, to ignore some of the other stuff, to just stop and enjoy the moment, enjoy the wind on your face, enjoy the butterfly flying by or the bird singing, something like that, because that will calm your brain down. That will wind down your nervous system. Nobody expects you to do this overnight. I think you expect the answer to come overnight.
That is true.
And see, I don't think you were an athlete when you were a kid, were you?
I tried every single sport, and I was not good at any of them.
Well, that just means you haven't found the right sport for you yet. So,
Exactly.
I mean, your sport could be chess. Your sport could be ping pong. I love ping pong, stuff like that. It doesn't have to be a big sport. But for anybody who's been an athlete, we learn about training and muscle memory, right? The foundation for learning a new skill is repetition. We have to train the muscles slowly and consistently over time. And as you train those muscles how to swing a tennis racket or catch a ball or whatever, that's the longer you do it, the better you're at it. And you start slow and you just keep doing it. And that's what I think you need to do. Is just start slow. 15 minutes a day, 15 minutes a day walking, 15 minutes a day doing an anxiety, 15 minutes a day doing something that will make you laugh. And you may never, ever allow yourself to buy soda again.
That's right.
Okay. Yeah. Or you can do what, okay, so like my pleasure would be a frappuccino. And my even if it's decaf, that's like my thing. I could do that every day easily. And my resolution is I can't do it unless I do something else really, really hard. I make it a reward. So it would be, for me, that would have been, okay, did you get on an airplane? If you got on an airplane and you flew somewhere, yeah, you can have your frappuccino. So why don't you make your sodas a reward for something really, really hard?
That's right.
Okay.
Yeah,
Yeah.
that's right.
You can do it.
I want to say I appreciate you reinforcing to me, and I admit, I mean, I'll be perfectly honest. I would love to be able to go say, hey, let me go through the drive-through and order a number one, healing your pelvic pain, and then get it at the first window, and I know I've been down this road before. And the thing that's interesting to me is that every time I am in what we'll call the flare up, is the manifestation of the symptoms can be slightly different. Maybe sometimes during one flare there's more genital pain, another time like there's more, like I said, bladder sensitivity. So it's interesting to me, that it kind of fluctuates, moves around, you know what I mean?
Well, it's just different. You just have different flares. So
Yeah.
you can have a flare from sitting too long. You can have a flare from drinking a soda. You can have a flare during a period of high stress. Different types of flares have different types of symptoms.
Mm-hmm.
So it's not like it's moving wrong and developing your whole body. That's not the case at all. It's just you're just having different types of flares.
That's right.
So being a little bit attentive to kind of what you're doing. So you had a soda last night and you're having a rough day today. Cause effect. Right?
Mm-hmm.
Yeah. So, trying to just do a little bit of tracking, making some notes, I think would be really good. Okay.
Yeah, kind of like a symptom tracker kind of thingy.
Yeah. But I would do a symptom food activity tracker. And you don't be super anal about it. It doesn't have to be perfect. It would just be, what did you eat? What did you eat for breakfast? And rate your discomfort on a scale of 1 to 10, and just try to get some trends there.
Yeah. Okay.
Okay. I think you'll find that very, very helpful. I wish I were closer to you because I'd come over to your house, I'd grab you, and we'd go take a walk.
I know. I appreciate that. Someday we'll do that, though. I'm always, just finish by saying I'm always so completely grateful for this group and for you, and I pray for all the other sufferers. It always so hurts my heart when I, and I'm listening to people's stories and people being through years and years of stuff, and I just say, and I'm so mad that doctors aren't more effective, So.
Well, and it's a failure of medical school, and it's also it just shows how little we know about the magic of the human body.
Yeah.
There's so many mysteries still. Like one of the mysteries is how do you pee? I mean, what neurological cascade happens every time you urinate? I mean, and researchers can get absolutely caught in the science. We call those basic bladder studies, to the point that they forget that they're working on a disease. And when I sat on the U.S. Army research panel, that was my job. It's like, okay, I know you love the science, and we could spend 20 years studying that molecule, but I've got Eric over here who's in pain, and we got to do something for him. So, okay. Now listen, you can call me anytime, hon. If you need a pep talk, give me a phone call, okay?
I will. Often I've called and I often get that voicemail. Just leave a message.
Oh yeah, because you guys, you gotta know now. Listen, I'm on the phone every day, and I return phone calls late into the evening. So for people who call and leave a message, you understand you're getting the voicemail because I'm working with somebody. I may call you back at 9:00 your time if you're on the East Coast. And so don't freak out about that. Okay. Just be prepared for people calling me back. Emily said the link is not working. Let me post it again. Hold on a sec. Well, we have people in here, so it has to be working for some people. You might have to download Zoom, maybe. All right, Eric. Well, listen, dude, you got this. You're tough. You're tough, but I really want you to have a mindset of being an athlete. You're now fighting pelvic pain, and I want you to approach every day as a fighter. You're fighting for your health. You're fighting for your life. You are fighting for the future you deserve to have. And you're fighting for good medical care, but it really begins and ends with, to a certain degree, your self-discipline. And I just need 15 minutes a day, exercises, 15 minutes a day, anxiety, 15 minutes a day, laughter. If you can just start building your foundation there, you're gold. Okay.
All right. Thanks, Jill.
It's hard. I know it's hard, but you got this. I believe in you. I believe in you.
Thank you.
Okay. And walking, as Kim says, walking can help with anxiety. And that's very true. Physical exercise helps your body produce your natural endorphins, your natural pain fighters. So moving and exercising is good. And Anne wants to know what I'm drinking. I'm drinking the pumpkin spice rooibos tea that's for sale in the IC Network shop. Julie says, can pre-leaf make one able to drink soda? Yes, it could, but let me pose it to you this way. If you had a wound on your hand, an open wound on your hand, would you pour soda on it? No. Would you pour soda with pre-leaf in it on an open wound? And the answer is no, you probably wouldn't, and you probably shouldn't. Your number one goal is to create an environment that will support healing. And so it's important you got to lose the acids for at least 3 months, preferably 6 months, to give your bladder an opportunity to heal itself. If you're, I hope that makes sense. All right, let us go now to Emily. Emily, can you unmute yourself? There you go.
Hi.
Hey, girl, how are you feeling today? How is life?
Well, life is mean a urinary infection.
Not usually.
No?
Do you have your?
Okay.
Do you have? Wait. Do you have your Walgreens box?
I do. It's
Okay.
like the Walgreens brand.
That's
But I
okay.
haven't been to the doctor.
Okay, so turn it around so I can see the backside.
Okay.
Okay. Do you have the white envelope the strip came in?
Yeah.
Okay. Can you?
Well, it said if it was beige, and I thought it was beige. I don't know.
Okay.
I have no idea what I'm doing.
Okay. So seriously, leukocytes are along the top. So you're absolutely positive leukocytes. You're in the middle group. You're not dark pink or purple. You're kind of a pale pink, and your bottom is negative. So that's not that is not suggestive of a UTI. If you had a raging UTI, you would have a dark pink on that emergency pressure or pain. So you have pain. So let's talk about this pain here for a moment. Where is the pain? Where is it located?
It is right.
That's okay.
It's like above my. It's like, here's the mirror. like right in here
Okay.
and almost here.
So so is it centered underneath your belly button, or is it to the left or right of center?
It's to the left more so. It's more painful there, but it is painful all the way across and down here. Like if you press it,
Okay.
it's just all in there.
Okay, so I want you to do something. Go to your hip bone right here. And anybody can do this. Use your hip bone. So I'm fat right now, so sorry. That's COVID weight gain right there. So here's your hip bone. Push inside on the hip bone just a little bit and see if it's tender.
Yeah, I mean, I'm always tender.
Do it on the other side. On the right hip bone. See, I'm more tender on the right side than the left side.
Yeah, I'm always tender, and I have throbbing pain.
Okay, so those are pelvic muscle attachment points.
Okay.
Right? So,
yeah.
Right? So have you okay, let's keep talking about the pain though.
Okay.
Do you ever have pain on the outside of your body, on your skin, or is it only on the inside?
Not, it's always inside.
Okay. And
like I feel like if I put that wand in there right now and pressed it, it would just be so painful.
Okay, so so you've just again you pointed to muscles, that if you touch a muscle it'll hurt. So you're pointing again to muscle. What makes it better? What do you do when you're in pain that makes it feel better?
Stretch.
Okay, so there you go. When you stretch and you work your muscles, you'll feel better. What makes it what makes it worse?
I think this was because of intercourse, but
okay. And so when did you have sex?
It was probably like Thursday.
Thursday.
So it's been
a couple of days.
No, but I've never had this much pain after that. So I'm like, is this a new thing?
Are you diet sensitive? Do you react to foods or not?
I do. And I'm not drinking caffeine right now. I'm not.
Okay.
I'm not doing any citrus.
How old are you? How old are you?
I'm 44. I'm 44.
Okay. Hello, perimenopause. Girl, you're there.
Okay.
You're there. Okay.
Yeah.
So the quality and health of your skin is going to start. It probably started a couple years ago. You're going to start noticing that things are going to be getting drier, and your bladder might be more vulnerable.
Oh, yes, that is a problem. The dry. This is the thing, though. I didn't know about any of the muscle tightness made it worse. I'm sorry, I should have glasses on. I can barely see. But I didn't know about these two things before I got on here today.
Yeah. So, there are many variants of IC, subtypes of IC. We no longer have a one definition fits all. We now clearly understand the diversity. For some people, IC begins in childhood. For others, IC begins in their 40s and 50s because of changes in hormones. For some people, IC begins after chemotherapy or chemical injury or drinking too much diet soda, while for others, IC begins because they fell on their tailbone and suffered a pelvic injury of some type. And then there's a group.
That makes sense.
Right.
I had a little injury.
Well, okay. What was that injury?
It's ridiculous, but I tried to be a skydiver, and I actually fell to my parachute got caught in a tree when I was 30, and I got thrown to the ground, but nothing broke but my finger, but I landed on my butt.
Okay.
So I got a huge bruise, and so maybe that has something to do with it.
That is
still IC though. Does that cause IC?
Well, it causes pelvic pain. You are a pelvic pain patient. IC doesn't mean anything. IC is a grab bag diagnosis right now. And so what we're trying to do is we're trying to understand your anatomy, your unique anatomy. Prior to you falling out of that tree, had you had any issues in your pelvis?
No, I mean, I was 30, but no.
Okay,
no.
so that's your trigger. I'm 100% confident that is your triggering event. I have worked with several Army paratroopers Same thing for
Okay.
them. Where a hard landing where you fall on your tailbone. Classic onset. And so,
Okay.
and you suffered a compression injury.
Yeah.
All of your weight landed on your butt or even on your tailbone. And so when you have a compression injury, the muscles are squeezed, the blood vessels are squeezed and broken, which is how you got a bruise, but the nerves were also squeezed.
Yeah.
And the thing that a lot of people don't understand is that in your nerve fibers, there is a nerve fiber is not just one nerve by itself. It's usually a nerve going this way and a nerve going that way with a little tiny blood vessel supporting them both. Little tiny capillary. When you had a compression injury that broke the blood vessels inside the nerve fiber, and it may have become a pressure injury because the blood may have stayed in the nerve fiber, but if those nerves don't have good blood supply, they have trouble functioning too. And so, but again, the great news here is that healing is always happening. Your bruise is long gone. But the question is what is the legacy of that injury? And the legacy of that injury has to be probably some muscle injury, because, I mean, you noticed that your answers were almost all muscle driven. What did you do to feel better? You stretch. Well, so that tells me that your muscles are a big part of the problem. So we want to make sure that you have a good pelvic floor assessment. And let's see, a physical therapist. Normally, your urologist or your gynecologist or your primary care provider would immediately refer you to a pelvic floor physical therapist. What state do you live in?
I live in Tennessee, and I do have a urologist in Nashville, but I don't think I'm high on their list of, I mean, I feel like I'm kind of
Tennessee.
I haven't had to go many times.
Well, yeah, but it's important that you tell them about that trauma.
Okay.
They need
I'll
to.
do that. I didn't know who to go to because I feel like I need that physical therapy.
You do. You at least need a pelvic floor physical therapy, a pelvic floor assessment, just so we can see if there is a legacy to that fall. And
the urologist will do that, or
a urologist
refer you.
Normally a urologist or a gynecologist, they would just stick their finger in, tell your muscles are tight, and immediately make a referral. And we have a database on our website where you can look for providers, or there's a fabulous website at pelvicguru.com, pelvicguru.com. That is the most up-to-date national database. And in my opinion, we need to explore that a little bit further. Okay.
Yeah,
and the fact,
I feel like I need to explore it.
And the fact that but wait. The fact that your pain isn't perfectly centered, the fact that you have pain to the left or to the right also points us to your pelvic floor. If it were just a bladder injury, it would be completely centered right over your pubic bone. But the fact that you pushed in by your hip bones and you had tenderness, you've always had tenderness. I think that a reasonable guess, and this is a guess, and I'm not a doctor and I can't give you medical advice. My job is to just open a door. I would bet money that your pelvic floor is driving a good portion of your symptoms. So it's time to go get that checked out.
Okay, I'll do that.
Okay. And then the other thing too, hon, dryness is an issue.
Yeah.
Okay. So I hate to break it to you, but you're there.
Okay. Thank you so much. I'm so glad I found you today.
Yeah. If you can, Google genitourinary syndrome of menopause. And you know what I'm going to do? I'm going to type it into the chat. Genitourinary syndrome of menopause, also known as GSM. Have you noticed moments when you get really angry, but you don't really know why? Or when you just start...
Absolutely.
Okay. And so we call those the estrogen rages. Have you had moments when you just start crying and you don't know why? You're just much more teary?
I don't cry very often.
Okay.
So I
Okay.
mean, maybe like if there's a sad movie, but I
Okay.
don't know.
Have you had, so what about, have you woken up anxious? And you just,
Oh yeah, I have anxiety. I'm on anxiety and depression medication.
okay. So,
Yeah.
so just know that one of the classic symptoms of perimenopause is free-floating anxiety, that you just wake up anxious and you just don't know why.
Okay. Well, that my anxiety was crazy. Was crazy, but now it's a lot better.
Yeah.
So.
Yeah. So you join the fabulous club. It's so weird because, like, how old do you feel on the inside?
I mean, young.
Me too. I feel like I'm 25. I honestly, I
Yeah.
do. I just
Yeah.
turned 60 years old.
Well, you look great.
Thank
so.
you. But it's like, what the F?
Absolutely.
I don't, the whole aging thing is baffling to me. It's so
It's
weird.
crazy. I have friends in their 30s and they're like, ouch, this hurts. And I'm like, yeah.
Yeah.
Until you're 40.
Yeah. All right, hon. Well, listen,
Thank you.
I hope you'll check back and just make sure.
Okay.
So when you go to the physical therapist, listen,
Okay.
you got to really describe your symptoms well. The devil is in the
Okay.
details here. So you can't just say pain down there. You got to try to point to the pain. Is it on the left side, on the right side? Is it low? Is it high? Is it shallow? Is it deep? What makes it better? What makes it worse? Does movement make it worse? When you bend over, when you sit down, when you squat down, things like that. Try to think about what makes it worse versus
I feel like moving helps.
moving
But
helps.
then when I stop, moving helps. But then when I stop, it's all like,
Yeah.
And I feel like the pressure on my, when I sit down, the pressure on my pelvis, it's like, that makes it worse. So this is all coming together like a puzzle now.
Okay. So like you desperately need this book. Breaking through,
what does it say?
Breaking through chronic pelvic pain. Breaking through chronic pelvic pain. I want you to read this, but as you read it, I want you to be thinking about the injury you sustained.
Okay.
And thinking about the structures that would have been involved on the left side and the right side. This would help you so much make yourself a good partner in your physical therapy. Because in the end, I want you to be laying on your back while she's working on you, visualizing the muscles. To visualize exactly where she's working, so that you can give her really good feedback about what's working well and what's not working well. And listen, if you do the assessment and they trigger pain, that is super exciting. That is your hallelujah moment. Because that means they found it. It means they touched it. So don't be afraid of the pain. That's super exciting. Okay.
Okay. Well, thank you so much.
You're very, very welcome. Keep in touch. I'd love to hear from you. Okay.
Jill, thanks. Jill, I just wanted to say how helpful Emily's interaction with you was for me. That was really great. I got a lot out of that. So I want to thank her first.
Yay! Hey man, we're in it together. We are the big IC family. And one day when COVID's gone, we will have to try to have some events again. Because I mean, it would just be so nice to meet every single one of you and give you big hugs and look you in the face and go, it's not your fault. No shame, no blame. Okay. All right. So let us go now to iPhone. I don't have your name, but you're right there.
Denise?
Yeah. Hi, Denise. How are you today?
Hi. How you doing? I'm fine, thanks, Jill. Well, I'm okay. I wouldn't be here, I guess, if I was doing great.
Well,
how are you?
I'm okay. I'm feeling pretty good.
Good.
What's up?
You addressed a couple of weeks ago about Candida, and I said about, honey was bothering me. Mm-hmm. And you said you sound like you have Candida. Well, I went to the gynecologist. She said I also had a bladder infection. I was in the hospital for shoulder replacement surgery in November. And anyway, since Thanksgiving, I've been suffering, I guess, because I had a couple drinks, and since then I ate a little too many sweets. But anyway, they get me on antibiotics, and I've been taking, super extreme probiotics. For some reason, I can't tolerate the monostat and the whatever, the tetrazole, whatever they call it, and my canazole. For some reason, lately, I can't tolerate that. Anyway, every time I have sugar, I'm like, or honey, I'm in agony.
Mm-hmm.
And
where? Okay, so where does it hurt when you have it?
Oh, my bladder, and I'm peeing all night.
Okay.
So, if I don't have honey or sugar the next day, I mean, honey is all I touch. If I don't have honey the next day, I'm fine that night.
Okay.
And I don't know if I still have Candida or not. I don't know if I still have a urinary tract infection. I just, I had a test strip. I did a urinary thing like your girl, what was her, Emily was before me.
Yeah.
And my test strip came out similar, like hers. It's like purple on top. And, but how do you know if you still have Candida? Because it's so tough to get.
Because you still flare with sugar, hon. I had a Candida infection for 2 freaking years. 2 years. I was like the Candida test case at my local hospital. I mean, I saw every single gynecologist on staff, and I even had one yell at me loudly, "There's no way you have Candida. You've just taken diflucan." And I said, "Prove it. Do a swab."
Oh, yeah.
I said, "Prove it. Do a swab." She did a swab. She came back and she apologized and went, "Yeah, you've got Candida."
Yeah. They give me diflucan. I'm taking like 60 billion percent, the probiotics you get into the refrigerator is 60 billion. I'm taking that like religiously.
So
I don't know how to get rid of this.
Okay, so when did this? Okay, so your history is that you kind of went through your history a little bit quickly. How long have you had IC symptoms? How many years? Is it new or old?
It's been at least 3 years. It's going on 4 years.
4 years. Okay, and how old are you now?
I'm 67.
Okay.
So,
okay, so it started when you were
definitely menopausal.
Okay, so it started when you were 63. So that would immediately put you into our estrogen atrophy group as our first likely substitute. And so are you doing a topical estrogen?
Oh, yes,
Okay.
religiously. But I had to stop that because they gave me boric acid inserts with, like I say, for the vaginal inserts.
And they gave you the boric acid because they thought you had yeast?
Yeah, and I'm out of that, but I'm still having problem with sugar, with honey, and I'm off the antibiotics.
So there's a book, The Yeast Connection. And that's the book that really helped me. And I just put a whole bunch of my books in storage. Do I even? Okay, so the fundamental concept in the yeast connection is that if you feed yeast, they grow. So have you ever made yeast bread? Homemade yeast bread?
Well, no, but I've seen it made.
Okay,
I understand that.
So normally you would season the yeast. You would put the yeast in warm water with some sugar, and you would watch it bubble and grow, and then you'd put it into your dough. So every time you eat sugar, you're basically allowing it to grow. And so this includes, that was the thing about the yeast connection that blew my mind, is it talked about all the sugar in things that we normally eat every day, like eating a bowl of pasta was like equivalent to eating 10 Snickers bars, and so I had to really take a look at my diet. Now, what I knew for me is I flared immediately if I ate anything with milk sugar. And we're talking agonizing pain. Any ice cream, any yogurt back then, it just killed me.
Yeah, me too.
And so I think it would be very interesting for you to have a next generation urine test to see if you happen to have Candida in your urine like I did.
I'm wondering.
it would rule it in or out. It would rule it out. You could have a vaginal swab next gen test, and you could have a urine next gen test, and that would tell us if you've got fungus, the specific species, and if it's antibiotic resistant or antifungal resistant. And so rather than guess, and you're guessing and I'm guessing, and frankly, you deserve more than a guess, that would be very, very interesting to have that test and just find out once and for all if that's true. Denise is saying, can you address sugar-driven UTIs? Yeah, sugar-driven. So it is a urinary tract infection, but it's not a bacterial infection. It's a fungal infection. That's what we would expect to see there. So I would have a next generation test. Go to bladderhealth.org. That's a website I built for that several years ago. And that will, you can watch several videos of doctors using it. Top tier infectious disease doctors are using it. All the COVID tests are next generation tests. And it would be a fascinating piece of data that would rule it in or rule it out. If it ruled out fungus and you didn't have fungus, then we would be probably looking at estrogen atrophy. Or if anything else happened when you were 64, did you go on a trip? Did you fall?
No, I've had chemo. Well, in the past, I had a bad fall in my early 60s. I mean, my late 50s.
Well, so that's important too. That's an important part of this diagnostic workup too, would be to get your pelvic floor muscles checked, just out of curiosity, to see if you happen to have tight muscles. Because if you have tight muscles, that's only going to make your symptoms worse. So next generation test, pelvic floor assessment, and you got to tell the doctor that you had a bad fall. You know, you had a bad fall in your late 50s, and you've been reading up about this now, and you've attended some support group meetings, and they've opened your eyes to the concept of pelvic floor injury. And you'd like to know if you happen to have any pelvic floor symptoms. Pelvic floor dysfunction. The classic symptom of pelvic floor dysfunction is you can't pee right away. That you go to pee and you have to wait 5, 10, 15, 20, 30 seconds or longer to relax enough to empty your urine.
No, that's not my problem.
Or it can be a burning sensation, a vaginal burning sensation. Okay. Wow. Okay. But that burning sensation can also be estrogen atrophy in your vagina. Sometimes there's a pulling sensation or a pushing sensation. That could be playing a role here. Or do you have pain when you sit down that gets better when you stand up? So
how do you get this next generation or next gen bladder?
You just order it. You order it. It's $199. There's two companies that do it, Microgen and Pathnostics. It's $199. And that would be just a useful data. It's useful data. And
where do you go to nextgen.com?
Bladderhealth.org will give you the link to do it. Yeah. Okay. So
thank you very much.
Yeah, and just know that I can see that you're miserable. You are exhausted dealing with this.
I am.
You look like me 15 years ago when I was going through that. Candida infections are brutal. And so let's just find out once and for all, but then also let's get your doctor to look at your skin, your vagina, your vulva, and let's see where you are from an estrogen atrophy standpoint. Because it sounds like
I've always had.
Okay.
I've always had really sensitive skin, so eczema as a kid,
Okay. All right, hon. Well, listen, carry hope in your heart. There's nothing about your case that scares me. It's just exhausting. Getting through there. It is, and if you can, go to YouTube and try see if you can find the book, The Yeast Connection. And there's a second book called The Yeast Connection in Women. I found those books very, very helpful. Okay.
Thank you.
Okay, guys, I just need 15 seconds. I'll be right back. All righty. All righty then. Let us go to.
Can I ask
Yeah.
Can I ask one quick question?
Sure.
You mentioned something about feeling better when you're standing up. What does that indicate?
Well, if you see, look, you can see what I just did. If you have pain when you sit down that is relieved by standing up, that means that the act of sitting is compressing a nerve, and the act of standing is releasing the nerve. Okay? Super, super mechanical. It's basically a mechanical issue. All right, Julie. Hello, Julie. Can you? There you
Hello.
go. How you doing, girl? How is life today?
Oh boy. I've been in a lot of pain for the last probably 3 days.
Darn it. Okay.
Yeah. And all the time, if there's bad days and there's worse days,
Okay.
basically. But this whole thing about your bones, I actually in the 8th grade, I went to sit down on a stool in art class and someone moved my stool and I hurt my tailbone really bad. And then
Okay.
I was the one who had said about falling down the stairs. And not thinking anything of it, like, oh, I'm going to get better. And my hips are always a mess and hurting, and I got to go to the chiropractor. And I thought, well, it's really interesting that, like, I have a dent there on my
Yeah, girl. Here you go. You need this book.
Yep. I wrote it down.
Yeah, you definitely need this book. I think it will be very interesting as you think about your injury and what structures that could have caused and how that relates to your symptoms today. Tell me a little bit about your pain. Where is your pain located?
It differs.
Okay.
It's I've always had UTIs as a kid.
Okay. Okay. So
I don't think that stair fall was really, triggering, but it probably made it worse because I've always had issues. My pain right now it's in my back and my hips and just like real tender all around my stomach and it radiates down into my thighs.
Okay.
And yeah.
Okay, so that's if it radiates down into your thighs, that's not bladder pain.
Okay.
That's muscle pain.
Right.
Right. So, but let's go. I want to go back to your childhood for a moment. So you say that you always had UTIs as a kid.
Right.
So you always had frequency, urgency, pressure pain as a kid. Did they ever actually find bacteria? Did they ever identify it? Were you on antibiotics that whole time, or?
Yeah, just whenever I would get one, the antibiotics would work. And then, as I got older and I had 3 C-sections and 1 vaginal birth, and then my last child, after he was born 11 years ago, it really got worse. And
how was that?
I thought it was.
How was that delivery?
That was a planned C-section.
Okay.
And I guess it was pretty normal.
Okay. And then you started to say, I always thought, what were you going to say there?
I thought it was my uterus. So I had a partial hysterectomy.
Okay.
And I remember being in recovery and they have me on, a morphine drip. And I'm like, I still have the same pain. Like it didn't even do anything, but make it worse maybe.
Yeah. You're not the only one. With thousands of women, tens of thousands of women have had completely inappropriate hysterectomies because the doctor or they thought it was in their uterus. Sometimes it can be, but with your history and the fact that you had issues when you were younger, kind of opens up another bit of a can of worms in a sense. Tell me, do you also have irritable bowel?
I believe so. I've never been diagnosed.
Okay.
But
And do you have vulvodynia?
yes.
Okay. Do you have TMJ?
Yes.
Do you have, isn't it weird that I know this?
Yes.
And do you have super sensitive skin? Like you can't wear wool? You have to be really careful with your skin, like texture?
A little bit, and I've only been noticing that recently.
Okay. And sometimes that happens as we get older too. How old are you again?
I'll be 50 on Thursday.
Welcome to the club.
Thank you.
Okay, Joe Biden and Tina Fey are trying to enter my meeting. I'm going to remove them.
Wow.
The YouTube prank people are, I mean, the Zoom prank people are coming.
Oh boy.
Hey, Kim Bat, I don't know if you're a real IC patient or not. And so if you're on Facebook or YouTube, could you please say, oh, okay. Oh, hey, Kim, I see where you, okay. So you look like you're an IC patient. Okay, sorry. Okay, so we have
Also, I wanted to say,
yeah.
I'm sorry.
Go ahead.
I feel a lot of pressure.
Where?
Like you say you feel pulling. I feel like pushing, like something on my bladder or everything in my pelvis is just being pushed on.
Okay, so
I always say someone's standing on it.
So do you, as the day goes by, do you feel like you're carrying a heavy bowling ball around in your pelvis? It gets heavier and heavier as the day goes on and you get more uncomfortable? Is there a heaviness associated with that pulling or pushing?
Yeah.
So
yeah, the pressure, I think.
So
whichever way you want to describe it.
There's a condition.
I lay down all the time. I'm always laying down.
Okay.
I just, because I have that pressure right now, and then like the burning, like I have to go to the bathroom. I know I don't. I just don't do it because I just went.
Okay.
Yeah, and yeah.
Okay, so you are truly an anatomical mystery to be solved. We have 5 core variants of IC, 5 core subtypes of IC. So let's go through this so the people on YouTube and the people on Facebook can see this. Hold on, let me get my slides here for a moment. Okay, because your subtype is not clear yet, but I think we can probably get close to it. So let's just put this in context here, okay? Okay, so as I said before, for some people, IC begins in childhood. For others, it begins after menopause. For sometimes it begins after a fall. For other times, it begins after chemical injury. And of course, we have a whole bunch of other conditions that can also victimize the bladder, like endometriosis, fibromyalgia, fibroid tumors, pelvic congestion syndrome, where you've got varicose veins in your pelvis, Tarlov cyst coming off of your spine. There are lots of other things that we have to try to rule out, especially if bladder therapies aren't working. And did somebody officially diagnose you with IC or not?
Yes.
Okay. And,
yes.
And how long ago were you diagnosed?
Would have been probably 2011, probably. Yeah.
Okay. Okay. So I use a subtyping system that was developed by Dr. Christopher Payne, who ran the IC research program at Stanford University for 20 years, and also chaired National Institutes of Health IC meetings. And he believed that there were 5 core variants of IC. Now, this is not nationally agreed upon. This is his system, but it's a system that I use because I think it works really well. So in his system, subtype 1 is Hunner's lesions. So these are the people who have bloody wounds on their bladder wall. They have a lot of blood in their urine, and these are pictures of lesions. They're known for having a red center with red arms radiating. So did anybody ever tell you that you had Hunner's lesions?
You know, I can't remember. I've been to like 10 urologists.
Okay.
But I did have a scope where I could see, he was showing me my bladder on the screen, and there was redness and like petechia, but I don't know if there was actually Hunner's lesions.
Okay, and the petechia have been thrown out. Glomulations have been thrown out. They're not believed to be diagnostic in any way now. We knew 10 years ago that they were associated with the test, that the test itself can cause some of that. But that doesn't mean that your bladder wasn't red and irritated. It could have been irritated from drinking coffee every day for all we know. Okay. Okay, so hold on. IC subtype 2 is bladder wall driven because the bladder, like any other part of the body, can be injured. But generally what we see is chemical injury, chemotherapy. So if you've gone through chemotherapy, patients with chemo, it's well known to have bladder wall irritation. Or if you've ever been exposed to ketamine, if you enjoyed going to raves and you took medication, some of the medication at raves. What's the name of the big medication at raves? Anyway, it's often ketamine's often cut into that. Or if you were a big diet soda drinker where you just weren't drinking water, you're drinking a lot of soda and coffee, that's where we would see this. So variant number 1 for this is going to be chemical injury. Variant number 2 for this is going to be estrogen atrophy. So how old are you? Did you start birth control? Because IC symptoms can begin after birth control. Or if you went into menopause early, or, whatever. So your age or your ability to produce estrogen is going to influence the bladder wall. Then the third thing we're going to look at here is chronic infection, but we're not just going to look at bacterial infection. We're going to look at fungal infection. Okay.
Yeah, that's interesting.
It is very, very interesting. And all I can say is thank God for the National Institutes of Health funding the MAP Research Network, because patients are getting better now. Okay. So how do we differentiate bladder wall versus pelvic floor pain? Bladder wall pain is very sharp and shrill. It's like razor blades in your bladder as your bladder's filling with urine. And that makes sense because if you've got a wound, here, let's use one of these. Okay. All right. So if this is your bladder and it's filling up with urine, as it gets fuller, the urine is getting into the wounds. And then as soon as you pee, bam, the urine is no longer in the wound. So pain as the bladder is filling with urine that is relieved by urination is a classic bladder wall symptom. Okay.
So what's crazy with me is, and I went to a doctor once and he said, so you have pain when you need to urinate. And for me, it gets worse after I void.
Right. Okay. Because
it's really bad.
What we see in this group, IC subtype 3 is pelvic floor driven. So now everybody watching, think about what she just said. Her worst pain is not as her bladder gets full. Her worst pain is after she empties her bladder. Generally, after you empty your bladder. Now, does the pain start as the last couple of drops are coming out, or does it start immediately after you're done?
I think at the end when I'm finishing going.
So
it burns.
So it burns. And where is the burning?
It feels like my urethra and just up into my bladder. It's how it feels.
How long have you had that symptom?
I've had that one a long time.
So how long? 5 years, 10 years, 20 years, 30 years?
Probably 10 years.
And when did you have your hysterectomy?
2011.
And did they take your ovaries or not?
No.
And you're just turning 50? How old are you again? You're just turning 50?
Yes.
So you had your hysterectomy when you're 40. So the reason why I kind of stopped there is so urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. So the urethra is kind of the first part of the urinary tract to now Kamala Harris is trying to come into our meeting.
least it's not Trump. I didn't say that.
Okay. Okay. So the urethra is kind of like the canary in the coal mine. It turns out the bottom half of the urethra is remarkably sensitive to the loss of estrogen. And it will feel like there's a drop of urine stuck in your urethra that won't come out. You ever feel
Yeah.
like that?
Yeah.
Okay. So that's opening up estrogen atrophy as a possibility for you. So we need to have a doctor look at your skin. And if your vulva is dry and your vagina is dry, there are characteristic signs they look for to show where your estrogen levels are. Your skin apparently develops little stripes. And so we need somebody to look at that. Here, hold on. Did you need something?
Envelope.
And you need an envelope. Okay, hold on, guys. My dad needs an envelope. You want to say hi? Walk over here so they can see you, Dad.
Excuse me.
And good afternoon to you.
Hello.
98 years old, my friends.
I've got
Nice.
a small one.
I don't have.
Yes, and several.
Oh, are you sending this to him?
Yeah.
Quit
You
smoking.
can just fold it in half like this. So, like, put it in there and then just fold it in half like that, and it'll be perfect. Okay.
Yeah, thank you.
Okay, you're welcome.
And good evening to you all.
Nice to see you.
Okay, so let's get somebody to look at your skin and let's see where you are. That hit me when I was 51. And my urethra got super, super irritated. And listen, guys, my IC self-help skills are pretty darn good. And I mean, because hello, I wrote the IC Network website. I threw everything I knew at these urethral symptoms and nothing worked. Nothing worked. And so I finally just threw myself on the mercy of my urologist, and I went in and I'm laying on the table with my knees bent. I'm back here and he goes, Jill. I'm like, what did I do? And he goes, didn't you use the estrogen cream I prescribed for you last year? And I kind of looking at him through my legs going, no. And he goes, why? And I said, because in my brain, I'm 25 years old and I couldn't possibly have an estrogen aging related issue. And he goes, Jill, I wouldn't have prescribed it for you if I didn't already see it happening. You have estrogen atrophy. And so what he did is he gave me a new prescription and he had me rub a pea-sized amount right into the entrance of my urethra. And within 10 days, the symptom was gone.
Wow.
If
it's interesting.
Yeah.
Sorry.
No, you go ahead.
My sister found a urogyno nearby, a new one, and she had gone to her and they gave her the estrogen cream because she complains about bladder symptoms. So I went shortly after thinking, oh, maybe she's going to give that to me too. But no, she didn't.
Well, how long ago was that?
This was about year and a half ago.
A year and a half matters. Because your ovaries are stopping. And the thing is that the ovary, you would think it'd be a gradual reduction, and it's not. What happens is your ovaries get very random, up and down and up and down. And that's what drives all the weird symptoms that we associate with menopause, the anger, the sadness, the tears, the anxiety. It's just these rapid swings. But over time, it does reduce. And a year and a half is a long time. So I would just say, can you just look at my skin down there and tell me if you think that's an issue? Because that urethral pain is a classic sign of estrogen atrophy. Okay. Other things that can cause urethral pain are going to be detergents, laundry detergent, fabric softener, wearing a mini pad, using a chemical down there. You are getting drier, and so you don't have that protective coating. And so we want to rule out chemical irritation of your urethra. If I put on a pair of underwear washed in Tide or with fabric softener, I will have urethral pain in about 10 minutes.
Oh, wow.
Okay. So look at that. Look at your soaps. And there's a blog on our website that talks about the 7 causes of urethral pain. But see, that doesn't explain the fact that your symptoms began in childhood. Let's go back to subtyping here for a moment. IC type 3 is pelvic floor driven. These are the patients whose symptoms began after a physical trauma. So these are the patients whose symptoms began after having a baby or a car accident or a fall or history of athletics, right? And
Right.
this is often what we see in children. And so it would be interesting to kind of go back in time, and can you remember any traumas that happened when you were younger? Like I broke the tip of my tailbone off in 6th grade. I totally remember doing it because I moved it around with my finger for months.
Oh, wow. Yeah, well, in 8th grade, that's when I had fell on my tailbone.
Right.
Uh,
Okay. So
I didn't have anything other than UTIs as a child.
okay, younger than 8th grade?
Yeah. But I just remember having them because that's how bad they felt. But, I'd be fine after antibiotics.
Yeah, but antibiotics have an anti-inflammatory effect. That doesn't mean that you actually had one. It might be that the anti-inflammatory effect just calmed whatever was going on down there. So that doesn't mean that you had UTI. And generally, we don't see that unless you're born with a birth defect. Sometimes there can be a birth defect where there's a little tube connecting your rectum to your urethra, and bacteria can go that way.
Wow.
Or there's
That'd be scary.
or if you just didn't wipe correctly where you were introducing it, and kids, but normally girls get that lecture early on, wipe from front to back, not back to front.
True.
Okay, so pelvic floor symptoms are subtly different: frequency, urgency, pressure, pain, but there's a pulling sensation or a pushing sensation. And rather than it being sharp and shrill, as your bladder's filling, it's a burning sensation. A muscle that's working hard is a muscle that builds up lactic acid and it burns. So there's a burning sensation associated with that. And the hallmark symptom, you're going to have pain with intimacy, pain with sex. I mean, obviously pain with intercourse. Were you always afraid to go to the gynecologist because you knew having a speculum put in your vagina would hurt? Did you just absolutely dread going to the gynecologist because you knew it would hurt?
Not until recent years.
Okay. Okay. Interesting.
Yeah.
And do you have any pulling, pushing sensation? Anything at all like that?
Oh yeah, just a lot of pressure.
Okay.
Like you could describe it as pushing or pulling.
Well, but
I describe it as
that can also be
pressure.
But that can also be pelvic congestion syndrome or a fibroid tumor pushing on your bladder. But you had a hysterectomy, so you couldn't have a fibroid tumor. Pressure is a hard symptom. Some brains interpret pain as pressure. But pressure, to me, in working with patients, it's more of a mechanical thing, kind of, sort of. So have you had a pelvic floor assessment? Do we know where your muscles are?
Not that I know.
Okay.
When I went to this new doctor, they did do a pelvic exam, but not really mentioning it.
And did they describe anything? Were your muscles tight? Did they say anything?
No.
Is sex painful or comfortable?
It is not painful, but the aftermath is painful for like the next week.
Right. Okay. That's because women normally go through a series of gentle pelvic floor spasms after intimacy. So that's a pelvic floor flare. That pain after intimacy is often a pelvic floor flare. Does heat make it better? Do you use a heating pad?
I think so. I've only recently started using heat. I used to take ice packs and just try to freeze it. Like
where
I just want to numb it.
Okay, where did you put the ice packs?
Like on my perineum or my, over my bladder.
Do you ever have pins and needles? A pins and needles sensation?
No.
Do you ever have numbness?
Not there.
Do you ever feel a vibration? Like something's fluttering or something's moving.
No.
Okay. But you have pain when you sit down that is relieved by standing up.
No.
Okay.
I didn't. That wasn't me.
Okay. Okay. I see subtype 4 is pudendal neuralgia. So rather than it being a bladder wall injury or a muscle injury, we're talking about a nerve injury. So these are the patients whose symptoms began, again, kind of after a trauma or a fall, where the legacy of that is that the nerves are now involved. And usually the nerves are involved. So if you are a bike rider, we see a lot of pudendal neuralgia in bike riding because the bike seat pushes right up into the pudendal nerve. So this is pain this could be pain shooting down the leg, sciatica. Do you ever have sciatica?
No, but I got a lot of other nerve issues with my spine.
Okay.
Like compressed discs and pinched nerves.
Okay. I have 2 ruptured discs right now too, so I feel your pain. All right. I see subtype 5 is the most interesting subtype. And this is called central sensitization or chronic overlapping pain conditions. So these are the patients who have wicked sensitive skin. Like I can only wear cotton. And literally the thread used in the seam can make me crazy.
Wow.
Like I can't wear any J. Jill clothes because of the thread they use, which is soft fabric, hard thread. It's ridiculous. So we have very sensitive skin. We tend to be drug sensitive, where a normal dose of a medication is too strong for us. We have to take half doses or baby doses. We tend to be food sensitive, not just for our bladder, but for our whole body. There are just some foods that really bother us. We tend to have a wicked sense of smell. We can smell things that other people cannot smell, and smells drive us absolutely crazy.
Yeah, that's me.
It's weird. It's weird that smells cause pain, but for us, they really do cause pain. We can be visually sensitive, where if there's a funky pattern in a carpet or a wallpaper, we have to close our eyes and turn away. And that was IC patient Carol who taught me that 20 years ago in my local support group. Or we can be sound sensitive, where we hear more than others, and sounds can really make us a little bit bonkers too. So a crying animal, a crying cat, a car alarm that's going off, it just triggers more for us. So what does this mean? Central sensitization is in many cases inherited. Hello, redhead, Norway. What do we know about redheads? We have quantitatively more nerves, and we are definitely very, very sensitive. But there's something new, and that is chronic overlapping pain conditions. So why do chronic overlapping pain conditions happen? And that happened to me. I mean, I had frequency urgency in 7th grade. I had vulvodynia in high school. I had IBS in my 20s, ovarian cysts in my 20s, irritable bowel in my 20s started. Then IC started, bladder pain started in my 30s. Why does that happen? And we now know why. And that is that for these patients, often even in childhood, their brain gets stuck in fight or flight. They tend to have a lot of anxiety. Anxiety is common, extreme levels of anxiety. And I had anxiety disorder for sure. And so so I attended a conference on it this fall, and the most important class was the pediatric risk factors. And what they found is in the year before the symptoms began, these kids had a major physical trauma, a trauma of some type. And so it could be a falling on your tailbone. That would be an example of a trauma, or being raped or sexually abused. That would be a trauma too. And that injury creates this kind of ripple effect from the muscles to the nerves, and then it spreads throughout the central nervous system, where the nervous system becomes more sensitive. But the other interesting part of it was that for some of these kids and adults, it's also triggered by bullying. and or abuse. And so, and that helps us. The example that I use is a new puppy. So you get a new puppy in your house, happy, 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 shaking his tail, running around, saying hi to everybody. And then when nobody's looking, a family member kicks it hard. And you hear it yelp, and the poor thing is going, what? What was that? But, it gets over it. Happy, 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 happy. The next day it happens again. They get kicked again. Well, at the end of the week, they're not the same happy puppy. Their tailbone is tucked between their legs, and they're walking into rooms like this going, where is he? Where's the guy who keeps kicking me all the time? That's an example of fight or flight. And so for children who are bullied, they get stuck in fight or flight every day, just like animals get stuck. But it can happen when you're an adult too, where if you're being bullied at work, every time you walk into the office, your fight or flight turns on. And when fight or flight is on, pain is intensified. Pain that is accompanied by anxiety is intensified by the brain. Pain that is accompanied by laughter is minimized by the brain. So that's what we think is going on now with people who are getting, and this is all about brain studies. I've talked about, we have a lot of brain studies now that prove that the sympathetic nervous system is not turning off. Normally, when you're facing a stressor, the sympathetic nervous system turns on, and then when the stressor goes away, it turns off. But what we're finding is it's not turning off. It's a central nervous system maladaptation. It's not a mental illness. It's just a nervous system that's trained to be in fight or flight. And so our therapy now is to break out of that, and that's mind-body medicine. So I've got a whole article that our latest magazine is all about that. So if you find, like, can you remember as a kid, were you bullied?
No, but I have had a lot of, it was a traumatic childhood, a lot of craziness in my life.
Okay. So, so the reason why I bring this up is, again, we're subtyping, and there is a very clear, distinct group of patients who have a lot of related conditions. And for those of us who have been in there, it makes you crazy because you don't understand what the hell's wrong with your body. It's like every year it's something new. And now we know it's central nervous system driven, and we know how to treat it, and we know how to calm it down.
Oh, wow.
And it's very, very exciting. This is
I'm excited.
Yeah. So let's see, where is it? Where did it go? Oh, here it is. This is our latest magazine, the IC Optimist. It came out over New Year's. And if you want to email me, I will send you a free copy of this by email so you can read it. Okay.
Okay. Thanks.
I'd be happy to do that for you.
That's very interesting.
Okay. So here's your homework. Number 1, get your skin checked out. Let's see where you are from an estrogen atrophy standpoint. Number 2, get your muscles checked out. Let's see where you are with your muscles, and make sure you tell them about traumas, any traumas that you've had. And then number 3, if you can, go ahead and read what I send you about the chronic overlapping pain conditions. And if you're struggling with a lot of anxiety, we've got to do something about that, because that's only going to make you feel worse. We got to deal with the anxiety. And I have a great video on anxiety and IC that would be helpful. Okay.
Okay.
So you're a mystery. I have no clue what you are.
I've been to 10 urologists. I've been to Cleveland Clinic, and I'm just like, I have doctor phobia now, and I put it off. I put things off of going, and I'm like, I don't know where to start.
Well, okay, but if bladder therapies aren't working for you, and you've done the bladder treatments and you're not getting better, then maybe it's not your bladder. And that's what the American Urology Association IC guideline said, is if you're not responding to therapy, if you're getting worse rather than better, take a step back and revisit the diagnosis. Let's make sure we didn't miss anything. If you've got that heaviness, we definitely want to make sure you don't have pelvic congestion syndrome. There's a bunch of confusable diseases that are interesting that, you just kind of start checking them off. But you can check off all the uterus ones because you don't have a uterus anymore. So,
right.
But is there a spinal cord issue? Is a nerve to your pelvis being compressed at L5? which
Yeah.
is where we would see it. Maybe that might be playing a role too. But the point is that bladder therapies up to this point haven't worked. You're still suffering. Let's step beyond the bladder for a moment and let's just rule out some other stuff. Because for all we know, it might be very easy to find. Okay?
Right. I also have a referral to the gastroenterologist for a lower GI.
Okay.
So that was my next thing to check out too, to rule things out.
So what are your bowel symptoms? What are you struggling with?
It's just a lot of cramping and moving around and nausea.
Okay.
And
Okay.
feeling like I have to do that too, as well as urinate a lot.
Okay. Okay. So just understand that pelvic floor dysfunction can influence the bowel. Absolutely. Yeah. And if you find that you're struggling with constipation, that could be because of tight muscles. So there's IBS-C, constipation, where you're just dealing with constipation all the time, or there's IBS-D, IBS diarrhea. That's what I had for years. It's gone now because I know what my triggers are, where you would eat something and 30 minutes later, you just have massive diarrhea and very, very painful cramping. I call them bend over and screamers, where you're like, you can barely walk and when you finally get to the toilet, you're just bent over in pain so much.
Oh gosh.
Okay. So, but very food related. For me, that was completely related to lettuce. Happened every time I ate a salad. And people with IBS, we don't do well with greens. I don't eat lettuce anymore, and I don't have those anymore. And then there's also another really interesting thing that he talks about in here that's called proctalgia fugax. And it is just a very strong, here it is right here, the ultimate anorectal pain. The term proctalgia fugax may sound somewhat comical, but believe me, the problem it designates does not make its sufferers laugh. Proctalgia, let's see, hold on. When you experience running deep anorectal pain, fleeting is what you pray for, and wiped out is how you are likely to feel when it ends. The upside is that the attacks are usually brief and they generally subside as one gets older, rarely occurring after the age of 70. And so these are recurrent episodes of pain localized to the rectum and lower bowel, episodes that last from seconds to minutes, and a complete absence of pain in between episodes. An estimated 14% of the population has this disorder, and it's a much higher in those with GI problems. The attacks are sporadic and quick, and they quickly resolve, so it's hard to get a doctor to understand it. Let's see. Hold on a sec. Described in 18, let's see. Well, anyway, it looks like it's trigger points in the hip rotator, adductor, abdominal, and psoas muscles. So rectal pain is related to appearance. Okay. Yeah, fascinating. So yes. You're not alone, my dear. You're not alone. And I say, why not have that workup, but also do a food diary if you can, and see if you can make any correlations with food. So the other thing, so I had those bend over and screamers every morning at 11 o'clock for 5 years. And my doctor said, when I first went to him for it, he said, you need to eat oatmeal every day. So believe me, I was eating oatmeal every day, and it was getting worse and worse and worse and worse. And then finally, my sister gave me a book on allergies and sensitivities. And the first thing it said is stop the grains. Maybe you have a grain intolerance.
Ooh.
So I stopped all the grains except for rice, and it went away. It went completely, went away. And then they had you introduce the grains one at a time. And when I introduced the oatmeal, that's when it happened. So there might be a weird food intolerance going on there too. Okay. Good luck, hon. Good luck. You're not
Thank you.
alone. You got this. You got this. Okay.
Okay.
Okay, hon.
Thank you so much.
You're very welcome. Have a good one.
You
Okay.
too.
And our last person is Anne.
Yes.
Hello, Anne. Now I can't, I
Hi.
see a picture. I don't see you.
Well, I'm in my pajamas. It's snowing out here, so I'm all tucked in.
Okay, that's okay. You stay all warm and cozy. How are you doing today? What's going on?
Okay, so I went to a urogyno last year,
Okay.
and she termed me as having IC just by symptoms, and I started going for pelvic floor therapy, and because I was urinating a lot, and I use a pelvic wand. And so this year I went to another urogyno because she's no longer practicing.
Okay.
And he told me that he didn't think I had IC and it was an overactive bladder.
Okay.
But so why would I still be having to use a pelvic wand if that's not really going to help overactive bladder?
Well,
And I think it did help my frequency by using it, but why would I have to use it if it doesn't really help overactive bladder?
well, number one, everybody's different. Number two, we're always going to follow the clues, and you have one giant clue, and that is that working with your muscles makes you feel better. But you have to understand that overactive bladder it's controversial. It's a controversial diagnosis. I can remember when it was first recognized. Overactive bladder was created by a marketing term that had for the company that made, I think, Ditropan or Detrol. And they had launched a marketing campaign, but they couldn't say incontinence. And so they came up with the term overactive bladder. And those are the old gotta go right now commercials that we used to see 20 years ago on TV. So they then paid a couple of major doctors, one in particular, I won't say who, to do research defining overactive bladder. Okay. And I can remember when it came out, I sent an email to a couple IC doctors and I said, so isn't this just going to make a diagnosis of IC much harder? And they all went, yes, we're very frustrated. The definition of anxiety, of overactive bladder does not include pain. It's incontinence, frequency, urgency. And so the way they differentiate it between IC and overactive bladder is the presence of pain. If you've got pain, you would fall into the IC group. But there's a more finessed variant, and that is urgency. If you find yourself running to the restroom, you've got to get to the restroom. Are you going to the restroom to reduce pain, or are you going to the restroom to prevent you from leaking?
I bladder train.
Okay,
so
but if you weren't, but why did you start bladder training?
From the physical therapist.
Okay, but no. Normally you bladder train if you're leaking. Bladder training comes up with leaking.
Never. No, I don't leak.
Have you ever leaked at all?
A little bit. I mean, it wasn't anything that I would go see somebody for. It wasn't anything. It just would be like some more pee on my underwear or something.
Well,
but I also had have urinary tracts that are always negative, and I had something going on 2 months ago, and they said that could have been IC because I had really bad, like, razor blades in my bladder from eating the wrong kinds of foods, I think.
Okay, well, and then, hun, we also have to remember estrogen atrophy. Estrogen atrophy, you're older, right? And so your bladder could be more sensitive simply because you have older. So, I think that the name isn't important. What's important are the symptoms. And what's important is what gives you relief. And if pelvic floor physical therapy gives you relief, then I would keep doing that.
I am.
Yeah.
Yeah, I'm going back again, but the wand, she said that, you know, she couldn't do Kegels with me. I have tight pelvic floor.
Well,
so I went for months.
Okay, good. As you should have. And you need to keep on that because tight muscles do a lot of damage down there. They restrict blood flow to the bladder, and it's very hard for the bladder to heal without good blood supply.
But that would cause more frequency if they're tight?
Yes, it absolutely could. Absolutely.
Okay.
Okay.
Well, I'm going to go back again, but I feel the wand has helped. I use it like every other day. And
Good.
I guess I'm going to keep using it.
Well, as long as your muscles are tight, the wand is the perfect way to try to retrain those muscles. So go for it, girl. Go for it. Okay?
Okay. All right. Thank you.
All right, my friends. That's it for Zoom. You guys, thank you for joining us on Zoom. I'm going to go ahead and close that meeting. Bye, Eric. Bye, you guys. You're not alone. All right. The Zoom meeting is over. And no, I don't want to update my computer. I desperately need to update this computer, but no, we're doing a meeting. All right. So Catherine on YouTube says, Jill, honestly, what is your diet on a daily basis to control IC and to keep it non-boring? Oh, and how much difference is in severity of my IC because I also have a caruncle. Let's talk about diet first, and then I actually just read about caruncles again in this new book. So we will open that book up for you, Catherine. So remember that everybody's an anatomical mystery to be solved. We have to understand your anatomy. But here's what we can count on. Some patients are absolutely going to be more diet sensitive. If you got Hunner's lesions, if you got big bloody wounds in your bladder, believe me, you are diet sensitive. And so the patients with Hunner's lesions are the ones who really have to be careful because acid on a wound hurts. Acid on a wound hurts. All right. And so these are the patients who should be avoiding coffee, tea, green tea, soda, multivitamins, vitamin C, fruit juice, cranberry juice, etc. You know, my dad is 98 now, and his bladder is very sensitive. And he's now really sensitive to acid. And even this morning, I said, now you know what my life has been like for 20 years, was like for 20 years before things got a bit better, being up all night peeing. He flared from eating a cranberry scone, a cranberry orange scone. And so we know we can't do that for him. I actually didn't want him to eat those anyway. He snacked on it. All right. So anyway, Hunner's lesions, you got to be careful with your diet. Genital urinary syndrome of menopause, estrogen atrophy. Yeah, you got to watch your diet because your bladder can't defend itself like it used to be able to. So you would be foolish to be drinking coffee or soda every day if you've got GSM. If you have any sort of chemical injury, chemo, anything like that, then you got to be careful with the diet. If your symptoms are pudendal neuralgia, and it appears to be pretty muscular, the odds are you're probably going to be able to eat a lot more. Okay, so my bladder's healed. I don't have any problems with my bladder anymore other than a little bit of aging. And so what do I do right now is I'm not doing coffee at all. I'm doing our rooibos tea. I'm doing Dandy Blend herbal coffee, which is very good. I'm doing mint tea and a combination of mint peach tea, which is actually working well for me. That tends to be what I drink. I eat normal breakfasts. I don't do well with a lot of white flour. I prefer doing gluten-free pancakes and gluten-free waffles, things like that. I don't have celiac. I can just tell you I don't get all bloated and gassy when I go gluten-free. My bread is Ezekiel bread. I love Ezekiel bread. It's high fiber. Perfect dinner for me is going to be sauteed vegetables on rice, or it's going to be something with what did we have? Well, I did chicken salad sandwiches last night. I made a homemade beef stew the night before. And I guess I have my list of foods my body doesn't like. And at the very top of that list for me, it's not my bladder, it's my bowel. It's going to be lettuce. I'm so much better not eating lettuce. It's stunning. And oatmeal and chocolate. I just don't eat those. Those will always provoke a really bad reaction in my body. Now, a caruncle. Let's talk about a caruncle for a moment. Hold on a sec. I actually just read a whole chapter on caruncles because I was not, I mean, I've worked with a couple, but I just didn't understand. And okay, so let me just see if I can find this. I think it is. Where is it? And of course, I have, this is not my book where I have my notes. That's in my living room because that's where I'm reading it. Darn it. Where is it? I literally just read it. Well, I can't find it. I'm sorry. I literally just read it. And I would love to have a picture that I could show you guys. Let me see if I can find one. Let's see. Oh, yeah. Okay. So, what would be a good way to describe this? So, a caruncle is kind of like, it looks like a urethral prolapse where it looks like the urethra is starting to come out of your body, but it's actually a little piece of tissue or potentially a bigger piece of tissue. It looks like a bubble that's coming out of the urethra. And they can be quite painful, and they can also block urine. So what are the symptoms of a caruncle? 32% are asymptomatic. They cause pain with urination, pain or discomfort, pain with intimacy, and rarely bleeding. I mean, it rarely bleeds, but it could bleed easily. And I do believe that, if I remember correctly, they were saying something about, God, I just read this like 2 nights ago. I'm confusing it with something else too. They also talked about that the inner layer of the urethra can detach from the structures deeper in the urethral wall and slide out too. I mean, it's just really fascinating. So usually they treat it with sitz baths and estrogen replacement, things like that. So anyway, Catherine said, always told I need greens. How do you get nutritional values they provide? I know I have too many questions, but the docs. Well, number one, it's just finding what you can tolerate. Now the greens don't bother my bladder, but they do bother my bowel with the IBS. I take our low acid vitamin very, very successfully. bladder smart. And so if you have a more limited diet and you're worried about your nutrients, going for a low acid vitamin is ideal. And so this is called the Bladder Smart Low Acid Vitamin. I take this every night before I go to bed. So the caruncles, I can't imagine how you feel with that caruncle, huh? Having a bubble of tissue right at the entrance to your urethra must be so freaking annoying. And does it give you pain when you're sitting? Nicole's asking what book this is. This is a book that we're going to be reviewing in the next week or two, called Facing Pelvic Pain. Is written by doctors at Harvard Medical School, as well as other specialists around the country. And I was invited to contribute a chapter in this book too, which I thought was really cool. I was really honored. So I'm working with them right now, we're building the website and doing the press materials for this book. So we're not quite ready to do the formal product launch yet, but it is available on Amazon right now, called Facing Pelvic Pain, a guide for patients and their families. And the cool thing about this book is it just goes over, you know, I love the way she's done the book, because there's no other book that's like this. This is really for the patient with pelvic pain who just doesn't understand why they have pain, and how to rule stuff out from different areas. So chapter 3 is what gynecological conditions can lead to pelvic pain. Chapter 4, what male urological symptoms can lead to pelvic pain. Chapter 5, what urogenital conditions. Oh, there it is. There's a caruncle stuff right there on page 53. I think that's where it is. Okay, so chapter 5, what urogenital problems can your urethra cause pelvic pain, etc. Small section on interstitial cystitis there, as well as overactive bladder, bladder outlet obstruction, underactive bladder. Chapter 6, what GI symptoms can lead to pelvic pain. Chapter 7, what musculoskeletal problems can lead to pelvic pain. Chapter 8, which nobody's ever done, what types of bone and ligament problems can lead to pelvic pain. Chapter 9, what neurological problems can lead to pelvic pain. Chapter 10, what rheumatological, neuroinflammatory, and vascular pain. And then it talks about treatments and adults versus children, surgery, coping strategies, sex, chronic pain. And the chapter I wrote, it's the last chapter, how can I learn more about pelvic pain? So I can now say I'm published by the Harvard Medical School group. It's crazy. Hey, Valentina, long time no see, girl. Should juicing be avoided with IC? I do believe juicing should be avoided unless you're really careful, because when you juice, you're eating more, you're getting more than you would do if you were eating the whole fruit. So, one of the things we say, for example, is if the apples generally are bladder friendly if they're Gala apples and Fuji apples. It's the other apple strains like a Red Delicious and a Honeycrisp, things like that, that might be more irritating. But, it's about the quantity of acid you're exposed to. You might also, for example, be able to drink you might be able to tolerate a slice of tomato on a sandwich, because there's very little acid in a slice of tomato, but there's a ton of acid in a cup of tomato sauce, because that's basically 10 or 12 tomatoes that have been reduced. And so it's kind of about the quantity of acid that we're a little bit worried about with juicing. I think you get a bit more than that, and that might be a bit more irritating if you're an IC subtype 1 and IC subtype 2. I do know that there has been a lot of talk on Facebook about doing green smoothies. And I can tell you that I would not do that. I personally cannot do that. Kimberly says Pathnostics doesn't do next gen. I've seen Pathnostics reports that were next gen. I always thought Pathnostics was much more comprehensive than Microgen, and you're saying the exact opposite. Emily, thank you for your 530 studies. Hello, Karen from Reno. I hope you're doing well. Shanna says that your doctor told you that you needed to contact an interventional radiologist. Yeah, no, hon, you do need to talk. An interventional radiologist has very specialized training in the pelvis and specifically in pelvic congestion syndrome. And that would be a very, very good place to begin to rule that out. Catherine says, thank you. It's very frustrating. The caruncle makes it hard for me to get around to my bladder to drain when I can't pee. Sometimes I don't know whether I really have to pee or if you're spasming. I can't imagine, Catherine. I mean, I think, I've only worked with a couple of patients in the last 25 years who had caruncles, and you're the first one in 5 or more years. I'd love to write hey, listen, you want to collaborate on an article? Let's do an article on it. Here, hold on. I'm going to put this on my to-do list. Catherine, if you could email me, we can do an article on caruncles, and maybe what I can do is either assign it to Stacy, our writer, or I'll write it, and then maybe we can get some suggestions from our medical advisory board to see how they would normally treat that. Urethral. I hope, are you at least getting better? Are you getting a little bit better with the estrogen? Ashley says, is White Claw sparkling water good for the bladder? Isn't White Claw alcoholic? If it's alcoholic, I would probably say no. Although, like honestly, with alcohol, again, it depends upon how damaged your bladder is. Buria, thank you for your 50 stars. I really appreciate that. Okay, listen, if there was anybody on Facebook who could not get into the Zoom meeting, please feel free to call me, and I'd be happy to work with you personally this week. I'm not going to be available until Wednesday. Tomorrow I spent all day with my mother at our infusion, and Tuesdays with my dad. So I won't be around really available until Wednesday through Friday, okay? Valentina, it's so nice to hear from you. I've often wondered, are you still in California? Have you moved? All right, guys, last call for questions. We've been going at this now for 3 hours and 30 minutes. Woohoo! 3 hours and 30 minutes. Holy moly. Thank you, hon. Thank you very, very much. So last call for questions. If you found this meeting helpful, please consider becoming a member of the IC Network so you can get our wonderful magazine. And I'm telling you, the latest magazine I just did, I think is the best magazine we've ever written. And the lead story is chronic overlapping pain conditions, why patients get multiple pain conditions, and more importantly, what you can do about that. Sandy says, what about fasting? Does it help IC people? No, I can't imagine that. What fasting would not structurally help repair the bladder wall, nor would it structurally help tight muscles. What it might do is clean up your urine for a day or two. But some people believe in doing cleanses. There's nothing that you need to cleanse. Please don't do bowel cleanses. Please don't do coffee enemas. Please don't do those crazy cleansing routines, because those are actually really provocative and irritating, and that's just not going to work. I mean, the last thing we want to irritate is tender tissues that are already sensitive and stuff. It's not fasting. I don't know. I don't know. I don't know. I don't deliberately fast, but I go long periods of time without eating sometimes. Does it help me or hurt me? I don't know. If I just do it too long, I just can't concentrate well, and I get kind of dizzy. Valentino, yeah, hon, please call me. I haven't talked to you in a while. You know, that big fire burned through my neighborhood. Our house almost burned down. That fire got 3 houses from my house. The last fire. So 2020 was brutal for us. Michael says, you mentioned how the spinal cord affects the bladder. Yeah. So, you know, one of the things that we look at, I mean, there are a couple of different conditions that we would be looking for. Is number one, you could have compressed nerves. If you have the nerves at your spinal cord that are compressed or injured that affect the bladder, that would certainly, you know, be a root cause for some people. But really what we see is central sensitization and allodynia. So let's say you fell on your butt and suffered a compression injury. And this is right out of this book. And he's got great pictures in here of what compression injuries do. And let's see, here it is. So let's just say you had a bad fall, okay? And you fell on your butt and you got bruising. So on a small piece of tissue, let's just say that this big a tissue absorbed all of your weight. You weigh 140 pounds, 150 pounds, 200 pounds. Bam, they all land, all that weight lands on the small group of skin and muscle. So what happens? Number one, the muscle is compressed. I mean, it's an injury. The second thing that happens is blood vessels are compressed. And blood vessels can be broken, just like muscle fiber can be broken. So if you have bruising, that's an example of your compressing and breaking the blood vessels. And also the nerves can be damaged when you fall, because the nerves have a little tiny blood vessel capillary going in each nerve fiber that the nerves use to function. But if you fall and rupture that nerve, that little capillary, you've now destroyed the ability of those nerves to function normally. So now we have the epitome of a sick nerve, for lack of a better term. And the challenge is that the nerves in the pelvis all merge together at the spinal cord. And I have a picture of that. Let's see if I can find that here. Where is that book? What? Holy crap! Stop it! Stop. Let me find this book here real quick. Is that it? Nope, that's not it. Stay. Don't fall. All right. Where is the... Here it is, right underneath my computer. I did not clean up properly after my last live stream. I didn't put everything back where it belongs. All right. So if you suffer a compression injury, and we know that those nerves are going to be traumatized, the challenge here is that these nerves merge. Here's the picture right here. So you can see all the nerves in the pelvis all end up at the same nerve root, up at the spinal cord. And they've done radioactive tracer testing where they put one radioactive tracer in your bladder and another radioactive tracer in your bowel. And those radioactive tracers merge in the same nerve root. And so the theory here is that the nerve itself where you fell was damaged, and that damage or dysfunction spreads along the nervous system right up to the spine. And then when it gets to the spine, it affects the other nerves that merge at that spine, and it goes back down to the other nerves. And so that's how Dr. Weiss explained that the bladder becomes dysfunctional, is because of that original nerve injury. And one of the things that perpetuates that is trigger points. And so when you fall on those muscles, you have now weakened that muscle. And in the areas where it's weak, the muscles compensate by becoming tight and or developing a trigger point. So here's a trigger point. And you can see that it is pushing and squeezing. Let's see. The capillaries. So these are the capillaries right here, right? So you can see that as long as that trigger point is there, you're not going to have good blood flow in that nearby blood vessel. And he also says in here that as long as that muscle has a trigger point in it, it will never be healthy. That's why we have to work with those muscles and trigger points. And that's where, you know, again, I remember the paratrooper one of the paratroopers that I worked with, you know, he had several very, very hard falls, and he was filled with trigger points. And as long as he had trigger points, it was going to be very hard for his muscles to be healthy. They've got to be treated. Marcella says, one more question. With a Candida labrata infection, let's say it's only in the vagina, not in the bladder, can that infection cause urgency and frequency? And I just went on the webpage and read the story of the Candida infection. How did they treat you for your vagina and bladder and skin infection? So let's do your first one. Can an infection in the vagina cause frequency urgency? They haven't done, I'm not aware of any biome studies that have cross-correlated Candida, both in the vagina, in that fluid, and in the bladder. They're so closely connected that I can't imagine. So I'm going back to a class that I took from Dr. Anthony Schaefer at the American Urology Association conference years and years ago. And it was on, why do people get recurring bladder infections? Why are there especially older women, they legitimately have a new infection every 2 weeks or every month, confirmed by a culture. And these patients are really suffering. And the question is why does it happen? And so in those research studies, they've done extensive research. They've done uterine swabs every day, urine samples every day, trying to understand where this infection is coming from. And what they consistently found is that 24 hours before it arrives in the bladder, it's usually living quite happily in the vagina. So the question then the researchers asked is, well, why has the vagina become a safe place for infection where the infection is prospering? And the answer came right back to estrogen atrophy. What he said is a woman getting a recurring infection, they should never be diagnosed with a simple UTI. It's always a complex UTI. And generally, they will almost always be put, in addition to an antibiotic, they will be put on a topical estrogen cream to use vaginally to improve their defenses. And so your question kind of relates to that. So if we know a bacterial infection can live quite happily and then eventually infect the bladder, could a Candida infection live quite happily in the uterus and then infect the bladder? And I think the answer is, yeah, definitely. But this is still very new, cutting edge research. So how did they treat mine? So mine started, my Candida labrata infection started the month after I ended long-term antibiotic therapy. I did Augmentin for 3 or 4 or 5 months, like probably 4 months. because that's what we did back then. Because back then in the late 1990s, we all thought this was weird infection. And so I did that protocol. And simultaneous to that, one of my best friends at that time, Diane, who helped me start the IC network, gave me a heated chair cushion. And oh my God, I loved that. So I could put a heated chair cushion on my chair while I was working. What I didn't realize was that I was creating the perfect environment for Candida to grow and prosper. As I sat on that heating pad for about 6 weeks every day, and I loved it. And then all of a sudden, giant yeast infection. And, yeast needs heat. Worst thing you can do is sit on a heated chair cushion like that. And it just didn't dawn on me. And ironically, my yeast infection was the worst on my skin. It had burrowed deeply into my vulva because of the heat. It was everywhere. It was in my it was in my vagina, it was in my urethra, it was everywhere. I did 3 or 4 7-day courses of diflucan. If you look at the literature for, the little medical product spec sheet that comes with your prescription, you'll find a small section in there that says some yeast infections do not respond to one diflucan. They require daily treatment. And so we did very aggressive long-term diflucan therapy. I mean, like liver toxic dose. I had to have my liver tested several times because of the high amount. But this Candida was brutal and exhausting. And then the second thing they did is they painted my vulva with an old-time remedy called gentian violet. And so I would walk out of the urologist with a purple hoo-ha. Hey, you're desperate. And I would, believe me, I was desperate. And did that 3 or 4 times also. And then I saw very quickly that it flared with milk sugar. So I had to stop eating ice cream, but I cheated. And every time I cheated, I paid for it with a yeast flare. But the ultimate mistake I made, aside from sitting on the warm chair cushion, is in addition to giving me the diflucan, they always gave me a topical nystatin. And I didn't use it because I thought the diflucan would kill it. And at my last visit to urgent care for it, because it was so bad, the doctor, they tested me for ovarian cyst. He goes, "You don't have an ovarian cyst, so let's look." So I take my pants off, puts me in the stirrup, and the guy gasps. He goes, "Oh my God." And I'm like, "What?" He goes, "I can see it. It's burrowed into your vulva." And he goes, "Were you using your nystatin cream?" And I went, no, because I thought the diflucan was enough. And he goes, "No, that's why we give you the topical, because there's not enough blood supply on the vulva to deliver enough diflucan to the tissue to kill the yeast." And so it was ultimately diving into the nystatin, and it was a combination of nystatin and a steroid cream. That, in the end, was what broke this Candida glabrata infection. So, and I did the boric acid suppositories, didn't help because the Candida was in my vulva. And then I did the Candida cleanse pill. I did all that. Nothing worked until, I did more. So Marcella says, "I went to the CDC website. Wow, finally I'm happy. I'm happy you had it." Not happy, but to have someone like you to explain it, because you had it too. I'm so thankful, Jill. I know idea how brutal this was. I have been feeling so terrible with it. I thought it was UTI. Nothing showed. Had a CAT scan, bladder camera, nothing. Urodynamics, just a small bladder. Yeah. Hey man, and the way I was diagnosed is I brought an article into my doctor on drug-resistant Candida infections that talked specifically about Candida glabrata. Candida glabrata is very stemmy. You know, fungus is normally round circles on a microscope slide, but Candida glabrata has stems. So it's like a structure and then a round thing, and a structure and then a round thing. So Candida glabrata is fairly easy to identify visually, and that's how I was diagnosed. Is that he could see the Candida glabrata under a microscope every single freaking time. Yeah, you've been taking hot baths, and heat would potentially make it worse. I will say that the gentian violet treatments, I don't know. I don't know if the gentian violet treatments helped. Gentian violet is very old school. I mean, they used to put it on dogs with skin conditions and stuff like that. And so it definitely irritated my skin for the first 24 hours. I mean, I drove home, and then I can remember, you know, being pretty uncomfortable after the gentian violet. Thank you for your stars, Marcella. All right, guys. Well, listen, as you know, I have no shame. I am happy to talk about anything, including vulvar candida. So let's give you your homework for 15 minutes a day. I need you to do, oh, here, hold on a sec. Catherine says, I had to swallow Nystatin 3 times a day. It was disgusting, but again, sought out a naturopath person where I found yeast cleanse. Cool. Good to know. All right, so here we go. Here's your homework. For 15 minutes a day, I need you to do something for your spirit, give your comfort. Whether it is watching a church service online, or reading poetry, or talking to somebody, do something that will give you some comfort. Because we're all going through hell right now. This is quite a time for us. For 15 minutes a day, I need you to do something for your bladder and or your pelvic floor. Man, get down on the floor and do your damn stretches. Whatever they told you to do, get out your wand, do it. Be consistent. Be consistent every day or every other day if you need it. That's one thing I fail at sometimes. I'm not as consistent as I should be. For the third thing, I need you to do something for your noggin. Come on now, you gotta improve your knowledge level. A lot of stuff you hear from me is really stuff that you only hear among the top tier doctors. Your local doctors probably don't talk about half of the stuff that I've talked to you about, like subtypes. Okay, so read an article a day. Come on, you can read a 3-page blog. Get your nerd on, get your geek on, or read a chapter. Just get a book and read a chapter a night, or half a chapter every night. Just get your knowledge level up. It's inexcusable for you not to know where your urethra is located. You have to know where these things are, okay? And what the difference is between a urethra and a ureter. Just get your knowledge level up. And then last but not least, for 15 minutes a day, I need you to do something that will make you laugh, because when you're in pain, your brain will minimize that pain in the presence of laughter, but your brain will intensify that pain in the presence of anxiety. So fill your day with joy and happiness. As you can see on my window, I have the word joy. Let's get some light into your life, my friends. Open the windows, let the sun shine in, watch some funny videos. There you go. All right, you guys. I wish you well. As always, you can reach me through the IC Network, icnetwork.org. Our phone number is over there. If you can, like our Facebook page, come on over to YouTube, and please like and subscribe our YouTube channel, because I'm going to have to split these up eventually. I'm going to have to separate Facebook and YouTube. And I might have to send everybody over to Twitch, and that would suck. But if you can like the page on YouTube, that would be great, because I'll be able to do more. All right. Big giant hugs to everybody. Love to everybody. Okay. How do we do it? Here it is. This is it. This is love to everybody. All right, you guys, I wish you well. You have a wonderful evening and a great week. And I'll see you on the other side next Sunday, but you might catch me on Wednesday or Thursday doing a drop-in meeting. We'll see. See you later. All right. Facebook is done. All right, YouTube. I will see you guys later. Have a good one.